unique topic, unique subject tonight, cerebral palsy. That is very unique disease, rare disease, but now common. So whatever Ayurveda can do, what Ayush can do, it is our prime importance to communicate to the society that yes, we are there to support you. Don't worry. And our government has decided to celebrate this 7th Ayurveda Day as Har Din Har Ghar Ayurveda. So we are on the same way right from last 2.5 years. And by that process only, we have been able to achieve 460th milestone today due to your mentorship, guidance, cooperation and contribution, absolutely with dedication towards Ayush and Ayurveda. I would like to welcome Vishnu Prasad Sharma ji, VK Agnihotri ji, Madan sir, and today we have respected Arun Pandey ji. Arun Pandey ji is Vice Chancellor of Mansarovar Global University. Welcome, sir. We are fortunate enough today to have you on the platform. Thank you very much. Dr. Akhilesh Sharma, an international figure based in USA and Delhi. Pranaveda Ayurveda Foundation Ayurveda Clinic is his clinic he has founded in Delhi, and he is frequently visiting USA and 20 countries for Ayurveda. So I welcome Dr. Akhilesh Sharma. I welcome Dr. Aswathi from Coimbatore. Welcome, young, energetic Ayurvedic faculty of Ayurveda in Government Ayurvedic College, Coimbatore. And without wasting much time, I would like to request Professor VP Sharma sir, President Vishwa Ayurveda Parishad, Assam, member NCISM, ex-president Guwahati Ayurvedic College. So many unique designations he has. Welcome, sir, for your welcome blessings.
Okay, namaskar. Good evening to everybody. Respected Professor Madan Thangabalaji, respected Professor VK Agnihotri, respected Dr. Pavan Kumar Sharma, respected Dr. Rajan Patankarji, distinguished guests, eminent speaker, ladies and gentlemen. Today, on this evening webinar on cerebral palsy, role of Ayurveda. It is an interesting subject. In this evening webinar, we have eminent speaker. I welcome all the eminent speakers. Dr. Rajagopala S., Associate Professor and Head, Department of Komarvitra, All India Institute of Ayurveda, New Delhi. Welcome, sir. Next, I want to welcome Dr. Aswathi P. Murali, Assistant Professor, Department of Komarvitra, Ayurveda Medical College, Coimbatore. I welcome you, sir. Next, I want to welcome Dr. Akhilesh Sharma, International Ayur Expert, Director, Global Herbal Pranaveda Foundation, Ayurvedic Center, New Delhi. So I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on cerebral palsy, role of Ayurveda. It's the most interesting subject. And today, all the eminent speakers will show us how we can show good result in such type of disorder. So once again, I welcome all of you. Thank you. Namaskar. Over to Pavanji.
So grateful to you, sir. Thank you very much. So before handing over this mic to Madan sir, I pay my regards to Agnihotri sir. Now Rajagopalanji, welcome. And would like to request Professor Arun Pandey sir, Vice Chancellor of Mansarovar Global University, for his inaugural blessings.
Thank you, Professor Sharma ji, for inviting me to this very valuable webinar. We all know that all diseases can be cured by Ayurveda, and this is the oldest practice which most of us in this part of the country have been practicing. And this particular topic today, cerebral palsy, is, I think, one of the rare diseases which is found in people who suffer a lot, but with the help of Ayurvedic treatment, such type of chronic diseases can be cured. And we have very eminent speakers today, Professor Akhilesh Sharma ji, Dr. Rajagopala ji, Dr. Aswathi, Murali, and we have eminent participants who are part of this 643rd webinar organized by Dr. Pawan Sharma ji. I congratulate him for conceiving the idea. And every time, in every webinar, you will find a new concept, a new idea, new speakers, and we all are benefited by the expertise of the distinguished speakers. And we have with Dr. Vishnu Sharma ji, Dr. Madan Thangavelu ji, Dr. Vineet Agnihotri ji, and Dr. Rajan, and all many distinguished participants are here. They are expert in their own field, and I am confident that in today's webinar, many new aspects will be dealt by the eminent speakers that would be of great help to not only those who are suffering from such diseases, but also for the knowledge of all the Ayurvedic practitioners. I wish all the best for this webinar and in coming webinars. Of course, because of some unavoidable circumstances, I could not attend earlier seminars, although I attended the inaugural program which was organized by Dr. Sharma ji and Mansarovar Global University. So on behalf of the Mansarovar Global University, on behalf of the Chancellor, Pro-Chancellor, and my own, I welcome all the eminent speakers and the participants. Over to Dr. Sharma.
Thank you very much, sir. We are fortunate today very much, sir. You have initiated the webinar, and now I would like to welcome Vice Chancellor Select of Sarvapalli, Dr. Sarvapalli Radhakrishnan, Ayurveda University, Jodhpur, Dr. Prajit Prajapati. Welcome, Professor Prajit Prajapati. Congratulations to you for being selected as Vice Chancellor. Welcome, sir, welcome. Now I have to call sir, na? Dr. PK.
Thank you, sir. Thank you.
Hari Om, Hari Om.
Hari Om.
स्वागतम.
जी सर.
बधाई सबको बधाई, हम सबकी तरफ से आपको बधाई.
धन्यवाद सर.
बहुत बधाई. आप 1 नवंबर से जोधपुर में वाइस चांसलर का पदभार ग्रहण कर रहे हैं. बहुत आपके साथ बधाई. हम सब.
Prajapati ji, we are delighted you are taking on this important responsibility.
Thanks, sir.
Very
Congratulations.
delighted.
Yes, thank you, sir. Thank you.
Dr. Prajapati.
I am really unfortunate that I got this news after a week due to Navratri. Great. Congratulations again. So now, your few words, inaugural words, Vice Chancellor sir.
बधाई हो सर आपको.
अभी नहीं सर. अभी नहीं सर.
तो रुकिएगा एंड तक.
हाँ, अभी नहीं सर.
रुकिएगा. अग्निहोत्री सर.
यस सर, पहले तो मैं तो आपको
you.
शेयर करना चाहता था कि मैं प्रजापति जी को कैसे बधाई दूं, कैसे करूं। फिर अंततः मुझे इन्हीं की एक शिष्या का दिल्ली से जो है फोन नंबर मिल गया। फिर हमने विधिवत उनको बधाई दी अपनी, और इनके साथ की फोटोग्राफ जो हमारे ऋषिकुल कॉलेज जिसे 23-24 जुलाई की, वो भी शेयर किया। तो प्रोफेसर प्रजापति जी, बहुत बहुत बधाई एक बार पुनः। और बड़ा गर्व हम अनुभव कर रहे हैं कि हमारे साथी लोग बिल्कुल क्लोज, एकदम करीबी लोग जो है अब वीसीज बन रहे हैं। इससे बड़ी खुशी की बात ही क्या है। और पवन शर्मा जी का ये भी खेद हमें दिखाई पड़ा कि उन्होंने कहा कि हमें लेट पता लगा। मैंने का पता लग गया होगा इसलिए मैंने उनको नहीं बताया। मैंने कि एक 18 घंटे पहले तो हमारी उनकी डायरेक्ट बात हो ही रही थी पिछली वेबिनार में। खैर, और उससे ज्यादा खुशी आज में इस बात की हो रही है कि प्रोफेसर अरुण पांडे जी जो हमारे दूसरे वीसी साहब हैं मानसरोवर ग्लोबल यूनिवर्सिटी के, उन्होंने पूर्ण रूप से प्रोफेसर पवन कुमार शर्मा जी को अपने में आत्मसात कर लिया है। आज हमें ये दृष्टिगोचर हो रहा है क्योंकि प्रोफेसर साहब के दर्शन, पांडे जी के दर्शन जो मुझे हुए इस समय, ये पवन शर्मा जी की बदौलत ही हुए हैं। अब हम
मेरा
आते
भी
हैं अपने
सौभाग्य है आप
नहीं,
सब लोग
बिल्कुल हम लोग तो बहुत उत्सुक हैं आपसे मिलने के लिए, आपसे भी
नहीं,
और
आप
भैया
आए,
से भी और दीदी से
स्वागत
भी,
है
क्योंकि
मानसरोवर में आप सभी का।
मुझे लगता है कि वो अपना एक बड़ा परिवार है और 3-3 संस्थाएं हैं। तो जितनी जल्दी आप लोग कुछ ऐसी व्यवस्था करवाएंगे पवन जी के जरिए, तो
कुछ
उस दिन
करते हैं ऐसा
दर्शन
कार्यक्रम
होगा।
जिसमें आप सभी लोगों को
जी जी,
आमंत्रित
नहीं न
करते
भी
हैं।
कार्यक्रम चाहे न भी हो, कार्यक्रम में तो एक औपचारिकता हो जाती है, भीड़भाड़ हो जाती है, शायद उतना समय नहीं मिल पाता है। जब हम 1 to 1 मिलते हैं तो वो हमें बड़ी खुशी है।
निश्चित रूप से
खैर, अपने जी विषय वस्तु पर आते हैं। जैसे कि पवन शर्मा जी ने आज अपने वेबिनार का जो टॉपिक रखा है वो सेरेब्रल पाल्सी पर रखा है। और सबसे बड़ी चीज है इसमें रोल ऑफ आयुष। मुंह से निकल जाता है अक्सर रोल ऑफ आयुर्वेद, बट रोल ऑफ आयुष की बात आती है क्योंकि अब हमारे लिए एक और महत्वपूर्ण बात हो गई है कि हमारे यूनिवर्सिटी के मेन कैंपस में और ऋषिकुल कॉलेज में हरिद्वार में दोनों जगह यूनानी और होम्योपैथी की आयुर्वेदिक ओपीडी चालू की जा रही है। तो इससे हम धीरे धीरे आयुष की तरफ बढ़ रहे हैं, आयुर्वेद से आयुष से बढ़ रहे हैं, और ये खुशी की बात है। तो हम जानते हैं
डॉक्टर साहब,
जी जी,
डॉक्टर अग्निहोत्री जी, यही तो इवोल्यूशन है।
बिल्कुल बिल्कुल। मुझे कल ही प्रोफेसर सुनील जोशी के जरिए जो यूनिवर्सिटी में डेवलपमेंट हुआ उसके हमारे पास क्लिप्स भी आए और न्यूज़लेटर भी आया। तो मुझे लगा कि अब काम बढ़िया है क्योंकि हमारे पास डिपार्टमेंट ऑफ आयुर्वेद में आयुर्वेद और यूनानी से चला आ रहा था, और उसमें हमारी यूनानी डिस्पेंसरी है, यहाँ पिरान गलियर में, लक्सर में है, और यहाँ शाहपुर में कई जगह है। लेकिन ऋषिकुल आयुर्वेदिक कॉलेज के अंदर यूनानी डिस्पेंसरी का इंडिविजुअल ओपीडी चलना और होम्योपैथी जो अभी तक मॉडर्न मेडिसिन पर था, डिस्ट्रिक्ट हॉस्पिटल लेवल पर था, वो अब आयुष के अम्ब्रेला में आ गया। ये बड़ी खुशी की बात हो रही है। इससे हम लोग और अपने को होलिस्टिक अप्रोच वाले मानने लगे हैं। चलिए, हम विषय वस्तु की बात कर रहे थे, तो सवाल ये कि आयुर्वेद में सर जी सर
कॉन्ग्रेचुलेशन अग्निहोत्री जी।
सर नमस्कार, थैंक यू सर, थैंक यू।
Thank you very much, sir.
तो
So now I am handing over the charge. Right, sir. Sorry.
I was just telling some 2-3 lines more that as far as the Ayurveda is concerned, we have got the holistic approach over the health, its preventive part and its curative part, irrespective of the name of the disease, which has now been said as cerebral palsy. Though it is cerebral palsy and brain being one of the topmost part and organ of the body, we should also be careful of that. So as far as our concern is, we have got a very good complete texture of manovritti, mana nirupan, the functions of brain, the functions of mana, etc. and etc. So as far as the involvement of cerebral is concerned, I think any disorder, it can be put under the framework of the equilibrium of the Vata, Pitta and Kapha. The basic the concept of the Ayurvedic Swasthya, Samdosha. If we start right from that one, we will definitely be in position to reach the ways and means to manage the cerebral palsy with the knowledge of our guest, great distinguished speakers. And one thing also I am just remembering, I am seeing our great knowledgeable person, Dr. Akhilesh Sharma ji. As I am recognizing him, I think Dr. Sharma ji, could you just recognizing me? I think we have met in Professor N.P. Duve's Integrated Medicines Conference several times in Delhi. When you used to be there, foreign and used to come. When I took your full size face, I found it, oh, it's one of us. So thank you very much. Your presence is very much encouraging to us all. So with these words, I just hand over the platform again to Professor Pawan Sharma ji. Thank you so much. Thank you all. Thank you.
Thank you very much, sir. So nice of you. So nice of you for your kind words. I would like to request Professor Madan Thangvelu, sir, for relieving me by the charge and taking the charge of moderation. I am fortunate enough to have him here. Welcome, welcome, welcome again.
Pawanji, namaskar. Thank you for bringing us again together on the 460th webinar. Our journey continues, and we are very fortunate to have two Vice Chancellors here with us today, Pandeyji Pranamji, Prajapatiji Pranamji, and so many senior academicians, practitioners are here with us today. Welcome all to the platform. We have a good gathering today. I have, with Pawanji's permission, I take the liberty of showing three screens that will bring us to the topic that we are fortunate to be discussing today. People always say, how can Ayurveda and Ayush systems, how can it handle a complex system? And what is the context in which you are working? Why are you taking these difficult problems that even modern medicine finds difficult to handle? So the number one screen share, partly because we have senior leaders of universities here with us, Prajapatiji and Pandeyji. This is the larger context, and this is a context that is related to India-UK roadmap, a 2030 roadmap for India-UK relations. It was published on the 4th of May in 2021, and you can see it's a discussion between the governments at the Prime Ministerial Office level. You can see here the UK Prime Minister's discussion, the Foreign, Commonwealth and Development Office. Now, this document is very important for us because it is putting a guidance for where the two nations are going to interact. And if you look within here, you will see it talks about investment, technological collaboration that improves the lives and livelihoods of our citizens. There are 5 sections in this document. I won't go into all of it, but it's a very valuable document for all of this. For those who are joining us on YouTube, it is very easy to locate this document. I'll put this up here for just 1 second. If you Google, you will get this document with those keywords, 2030 Roadmap for India-UK Future Relations. I want to take you quickly to the very last section, the 5th subsection of this document. And that is very important for, you see this 5th section relates to health. As a global force for good health, good in health, the UK and India will use our combined research innovative strengths to address the biggest global health challenges, save lives and improve health and well-being. And it touches on COVID. We have done a lot of work in India, antimicrobial resistance, which is a very big aspect, non-communicable diseases. This is a very, very important issue, not only for UK, but also for the European Union. Digital health. Section 32 is very important for us. Ayurveda and alternative medicine. Explore cooperation on research into Ayurveda and promote yoga in the United Kingdom. And point number 33, NHS partnership and health worker mobility. So that is document number 1. You can see very clearly Ayurveda alternative medicine is in this very high level document. I now move to the second web page, which is to do with the health service. And here you can see, once again, those who are joining us on YouTube, please, you will be able to locate this document at the National Health Service website on cerebral palsy. Now, there are many things here about cerebral palsy and symptoms. We can learn a lot from the way it is described here, but we can also learn in this very short 4-minute presentation by one of the consultants there. I won't go into this, but you can see how the condition is presented and described. Now, to go to the 3rd screen share, this is the answer to everybody's questions. And I'm showing you here one of the many sutras within Kannada's sutra, one in particular that I want to highlight. This is the Vaisheshika Sutras. And this sutra here is very important. Sutra number 5 in the first section. It talks about the 9 substances. And it says, Prithvi, Akash, etc., etc. There are substances are only 9. Dravyas are only 9. There are many other expressions in here about Indriyas and all these things. These are all derived from very deep principles. And when we go into these deep principles, we really understand what Agnihotriji was highlighting. That integration of systems of medicine within Ayush systems and outside Ayush systems. The true integration will come when we can see the depth and the importance of such sutras. Vaisheshika Sutras, Sankhya Sutras, Nyaya, how it is used, and of course, Yoga Darshana, which is very important. And all of these, I hope we will hear today from our expert scholars. So, Pandeyji, this is just to show how the responsibility moves from the prime ministerial level, government to government, and trickles down into people like Rajagopala ji, who's here from All India Institute Ayurveda, to the academic institutions like what Agnihotriji mentioned, and Mansarovar International University. And along with our leaders now, our leaders of the university, Prajapati ji is there, and so many others, we will be able to come and match the demands being made at the prime ministerial level to give substantial outcomes so that this whole initiative can move forward. So with those few words, Pavanji, I hope I could convey a little bit about the broader context and what the NHS is doing, the health service is doing. That is only for cerebral palsy, but also for so many other conditions. And what people like Prajapati ji, Pandey ji can help rethink along with their departments and faculties how to shape a future for all of us. And keeping in mind the purity and the sanctity of the darshanas, Vaisheshika, Nyaya, etc., to be the driving force for shaping that future. Namaskar ji.
Thank you. Thank you very much, sir. Now I would like to request Dr. Akhilesh Sharma. He was also faculty for UK and USA. He can describe more in detail. And his mother is seriously ill today, but really I salute his dedication today. And today he is joining from his house, rather we can say, and wanted to take his mother to the hospital. Thank you. He wanted to share the practical experiences, what he observed in his clinical practice. I would like to welcome my friend, Dr. Akhilesh Sharma from Delhi.
Akhilesh ji, pranam ji.
Please unmute yourself.
Pavanji, there is somebody with the Galaxy A31 waiting. I will leave it to you if you can identify this person before they can come to.
No, we can't identify, sir. We can message.
So I leave it to you, Pavanji.
Akhilesh ji, welcome.
Akhilesh ji, pranam ji. Thank you so much for joining us today.
Pranam, Madan ji, and it's a matter of great privilege for me to be part of this August gathering. And I see my dear elder brothers, stalwarts of Ayurveda, especially people coming from institutions, especially 2 vice chancellors. I salute to them from the bottom of my heart. It's a matter of great privilege for me to know that we have such outstanding personalities now leading the institutions, and they will be the future gurus, visionaries of Ayurveda, and will change the pattern of promotion and propagation of Ayurveda. Before I start my presentation, I'll make a small chant, a powerful healing mantra, and then I'll open my presentation. Om Bhai Bhaishajam 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 Raja Gate Swaha. Thank you very much, everyone. It's a matter of great privilege for me to be part of this divine knowledge, so-called Ayurveda. The way the masters have said, that Ayurveda is a divine knowledge beyond space and time. And it also comes into your life because of your past life karmas. And blessed are those who get exposed to the pure knowledge of Ayurveda. Not that everybody has access to it. That again comes into your life in the form of a healer, in the form of a doctor, in the form of a patient, because of your past life karmas. That's how beautifully some masters have narrated about the significance of it. With that, I will speak briefly about the current topic, so-called cerebral palsy. And I'll straight away come to the topic. My point of discussing about this difficult subject, so-called cerebral palsy, which is a challenge all over the world. Because if a child is healed, the society at large, the family members, and all the relatives and friends, they get to know the efficacy of the treatment pattern we are following, and that the sound is loud and clear. So that's how I ended up interacting with one of the leading clinical psychologists in the United States about 26 years ago, when I started my career, being representing Ayurveda there and being part of an institute called California College of Ayurveda in the state of California. I accidentally ended up meeting one clinical psychologist who was also a hypnotherapist and had done many researches about cerebral palsy. His name is Dr. Brian Sheen. And we started working on certain simplest formulations of Ayurveda. And we were able to make a compilation of statements of mothers of 20 children who were severely affected with their incorporation of Ayurveda into their daily life, in their ahar, vihar, vichar, and sanskar. And we found outstandingly positive results out of that. And we compiled a book called Educate, Don't Medicate. So that book itself has been able to turn the tables and started creating a different viewpoint about cerebral palsy and how to address it. Because nobody ever before had done that effort. See, management of cerebral palsy always remained a quest for the physicians all over the world. Even with introduction of newer or better possible ways to improve the functions of the child so that the quality of life is improved, is still a challenge for them. And as we all know, I mean, all of you are stalwarts of the subject, but still just to remind you, we all are aware that these symptoms include like poor muscle tone, muscle stiffness, uncontrolled movements, and also people with ADD or ADHD also have those kind of behavior disorders, hyperactive children. They have problems with their balance, posture, coordination, problem in walking properly, swallowing, speech is a challenge, mental retardation, breathing problems, seizures, learning disabilities, bowel and bladder control problems, skeletal deformities, dental problems, eating difficulties, digestive issues, vision, hearing problems. So the severity may range from mild to moderate or to serious nature. Now, all the symptoms which I spoke you about, if you start categorizing symptom-wise and then address them with Ayurvedic perspective, that is the way to go. Like, if you're talking about problems with the balance or posture or coordination, walking, that means we want to do Vata balancing performance or Vata Vyadhi spectrum, we need to understand. It is a Vata predominant disease. So, effect of some of the modalities of Panchakarma, which is Abhyanga, which we had, the only tool we had there in US to use and incorporate into our daily practice, was one of the key tools for improving their postures, for walking, for coordination, balance, and other symptoms. As I said, breathing problems. We have wide range of our medicines, say from Sitopladi Churna to various bhasmas. We have been using some of the standard potentized medicines like Breathe Easy powder, Abrak Bhasma, Malasindura. Then talking about mental retardation, we use a wide range of medicines, say starting from Brahmi, Shankpushpi, Jatamansi, Vacha, using nasal drops of ghee because that was the only source thing available there. But the other things we were able to procure from India and incorporate into people's lives. Then bowel and bladder control. All of you know that we have wide range of things like Bal Chaturbhadra Churna, which is good for promotion of the Agni, balancing their appetite issues, because if the Agni is good, then their assimilation of the micronutrients is better. Then their overall capacity and capability to improvise their mental and physical faculties. It has multidimensional application. I mean, I tell you, sky is the limit. And incorporating some of the yogic practices has been phenomenally good. For instance, usage of Brahmari pranayam, which has been able to stimulate all the cranial nerves of individual children. And we did some studies also on that. And effect of Brahmari pranayam, effect of Anulom Vilom, which is effect of Brahmari has been as good as hyperbaric ventilation in the brain, which was able to get us 40% more oxygenated supply to the gray matter. And that has phenomenally worked very well in all the such cases. Then in Nasya Chikitsa, as I said, we used ghee as nasal drops, we used Malkangani Swaras, we used Malkangani in the form of the oil also, and that has been instrumental. And using almond as almond oil drops in the form of milk mixed with the different food forms. And of course, talking about dental problems, we used various dental powders, whatever was available there, like Vico Vajradanti or G32 tablets, or various other ready-made formulations, whatsoever we could find. We could give them douche also with Triphala, with ghee, with curcuma. All this combination we have been using. And digestive issues, of course, all of you know, I don't want to go in detail. We were able to procure Bilva, Hingwashta, Kamalki, and we were able to make some formulations or using things like Bal Chaturbhadra, not only Churn, but Bal Chaturbhadra Ras was used also. And sesame oil, which has been phenomenally good in my personal experience, because of the presence of selenium in sesame oil, has been a drug of choice. As we all know, skin being the largest organ of the body, the nervous system lives here. Doing regular massage, just Abhyanga, which is just a Purva Karma according to Ayurvedic principles, has been phenomenally good for calming them down, for hyperactive children, even for children with cerebral palsy, ADD, ADHD, it has been really a phenomenally good drug of choice because that was the only option available. We didn't have access to many of the traditional Ayurvedic oils. So sesame oil, which contains selenium, zinc, cobalt, copper, iron, sulfur, all these, and calcium also is one of the important ingredients. It was being assimilated into the body through the skin. So what we started doing is, in my personal practice also there, what we did, we are making children take shower. After the shower, when you wash them with the soap, and then you put an oil coating on the body. First you pat it and then you rub it. And there was a mini so-called abhyanga during the shower, because that is the only thing, because they are very particular about thickiness or greasiness of the oil. So when we pour the oil on the body, do the massage, and then pour another bucket of water on them. So make it kind of an emulsion of oil and water on the body. So some part of the oil will penetrate through the oil, because the emulsion is created on the surface only. So some part of the oil penetrates deep into the skin, and rest of it some falls down on the ground in the bathroom, which is fine. And it becomes very thin coating of oil on the body, which calms down them and which also brings more flexibility, more oxygen supply in the body, more tissue level flexibility and elasticity, and bony level flexibility and elasticity, which helps to strengthen their musculature, their structure, their deformities. All the skeletal deformities are very carefully addressed with that. And even for vision problems, we have been using things like, again, symptomatically, whatever we had. Saptamritla was there, Trifla was there, Chyawanprash was there. We were using source of Amla as Chyawanprash, or even Amalki was available readily. We were able to use it frequently as part of their daily food habits. Amla candies was, that is not the right choice though, but just to make children aware of that there is something which would be good for them to eat. So gradually we developed the taste of Chyawanprash for them also, and eventually brought them gradually to pure Amalki Churna. For the hearing problems, we used Bilva oil in them. We also used Ekangavir Ras. In many of the cases, we were sending them individually directly from India because Ekangavir Ras was not available there. And ashwagandha as a base powder is readily available. So if you crush the Ekangavir Ras in specific dosage, mix with ashwagandha, make them lick them with honey, was the way we have been dealing with all those children. And how did I get all these children? There were different support groups of children suffering from such diseases country-wise. So we used that as a source of information to get the information and collect the database and directly deal with the patients and going out of the way. And we were able to not only win their hearts, but get the good results. So what I'm trying to say is we have put basic introductory aspect of Ayurveda, and believe me, this one medicine, into my personal experience, so-called Kumar Kalyan Ras, has been my favorite drug of choice, which can really help to rejuvenate the gray matter if done proper scientific evidence studies in our medical schools in India. We should plan a strategy to collaborate with such departments, say pertaining to, say, mental nervous system. We don't want to deal with the entire neurology department. Say we want to make it tailor-made treatment protocol for specific diseases. Like if you are saying cerebral palsy, let's take that as a challenge and treat only cerebral palsy children as a collaborative research protocol with AYUSH University to any other university or collaboration with the medical school in India. And here, because legalities are not that severe as the way they are in US, I was taking chance myself, going out of the box and treating those individuals, even doctors who were neurophysicians, neurosurgeons, at various hospitals. I made a personal rapport with them and stealing their patients. I'm using the word stealing. I took that chance just because I believed in my own system, I believed in the results, and we were able to convince them to kindly eat what we are giving as a dietary food supplement. And whenever anything goes wrong, I'm liable, I'm responsible. I used to win their hearts, but taking their disclaimer as a protective document, and then willingly doing it. Because if they do all the research protocols in allopathic medicine where there are severe side effects, why can't we do such experiments? We have to be bold to make that decision and go forward. But in India, legalities are less. We are the pioneers of Indian system of medicine. We have all the tools and we have the legal rights to perform that. If I can do it in a country like United States, why can't we turn the tables in India? So what I'm saying is, and role of Panchakarma, for instance, treatment involves intensive Panchakarma therapy programs with oral medicines also. All the therapies, as I said, Abhyanga, Swedanam, Nasyam, I already narrated. Pichu, Shirodhara is also another thing. You know, in some places at medical schools, I made demonstrations about Shirodhara. And the doctor at a medical school says, Dr. Sharma, prove me that Shirodhara works. I said, well, look at the clinical assessment of an individual. He said, no, prove it to me in the test tube. Unless you don't prove me in the test tube and the bloodstream, I don't believe it. I said, sir, so there is no, it's not written in our books. He said, then who cares about your books? I believe in results and I want to see results in black and white. So I was under deep, inquisitiveness within myself. I said, how do I prove now that Shirodhara works? So for that, what did we do? We mixed some radioisotopes in the oils. We did the blood chemistry of the patient before starting the treatment. And then 15 days after the treatment, when we did the blood chemistry of an individual, the radioisotopes were present in the bloodstream. That means it was penetrating through the skin and crossing the blood-brain barrier and assimilating into the system. So they said, my God, this thousands of years old technique works like this? Hard to believe. I said, sir, no wonder. Why? There's a long queue waiting to get the Shirodhara done when they come to state of Kerala in chartered flights altogether. But the irony is, in the birthplace of the country where it belongs to, many places we are still suffering from a disease called ignorance, and we have no idea what just Shirodhara can do. So, of course, for cerebral palsy also, if we say we want to conduct a research on effect of Shirodhara on cerebral palsy conditions, and if you compile a database of even, say, I tell you, 100 children, and very generously, very honestly, you compile a database, you will get an idea of what it can do. Whether Akhilesh ji, it is 100% true. Kindly display the message, please, so that I get to understand and I can answer accordingly, please. What was the message? Pawan ji, please, usko dobara display पे डालेंगे. मुझे यहाँ दिखाई नहीं दे रहा.
क्या अखिलेश जी?
अभी एक मैसेज आया था. It is 100% true. कोई ओपिनियन किसी ने कुछ दिया था.
वो ओपिनियन बाद में डिस्कस कर लेंगे अखिलेश जी, अभी 2 स्पीकर बाकी है.
ओके, ठीक है. मुझे
टाइम इज लेस.
अच्छा, ठीक है. तो देखिए, इसी तरह से इफ वी आर, उसके मल्टी डायमेंशनल और एस्पेक्ट्स ये हैं कि स्वर्ण प्राशन संस्कार शुड be incorporated in all such children in India, and also make an international collaboration to introduce Swaran Prashan Sanskar in children suffering from ADD, ADHD, and cerebral palsy. And I have been combining those things in my personal practice and incredible results. And of course, using preparations of our preparations like Brahmi, in the form of Brahmi hair oil, because Brahmi has wonderful properties of working on our Dhri, Dhriti, and Smriti. It has threefold action, as we know, which improves our long-term memory, short-term memory, and retaining capacity, the way it has been narrated in our books. So Brahmi is used in form of Brahmi Ghritam, in the form of Brahmi hair oil, in the form of Brahmi massage oil, and oral incorporation in the form of mixing it with honey or giving the capsules also would be a good idea, but do it at war footing level. Then I would say some of the other modalities, as Mr. Madan Thangavelu also rightly said, there has to be a mutual integration between the systems. And I'll tell you one thing, I saw that one thing happening. There was an integrated medical conference somewhere in Cartagena in South America, where they have been made groups of disease-oriented integration of Ayurveda, homeopathy, Unani, Marma Chikitsa community together dealing with the same patient. So this would be also a wonderful idea, integrating the systems on specific diseases also. Marma Chikitsa, for instance, Dr. Sunil Joshi has been doing commendable work on that. So his kind of perspective and other experts of different perspective of Ayurveda should also be incorporated to deal with cerebral palsy kind of conditions. Then many other things like Arvind Das has been my drug of choice for giving for their physical and mental well-being. And of course, spirituality practices, chanting of certain mantras, which is more of a divine practice from the Indian not only mythology, but Indian scriptures of Ayurveda too, should be integral part of practice for using into, dealing with cerebral palsy. And the success stories have already been compiled up, as I said, in the form of a book, and we promoted it smartly in the form of a book and with the success stories of narration of all the symptoms, significant improvisation, where the child started speaking few words, where their eye-to-eye contact got better, where gait and gesture got better, where clarity of the thought process and focus on things improvised drastically. This needs further evaluation. So this is all what I would say, and I will sum up. Any question anybody has, I'll quickly answer, because after that I have.
We will definitely communicate their questions to you later on. But as per our system, the question answer session will be done after all speakers.
Okay.
All the best. Please take the care of your mother. Thank you so much.
Please excuse me. Today I have
Yeah.
to really go for this season. Otherwise, I would love to stay and listen to the event later on. Thank you very much.
One question has come in. Could you tell us a little bit about the book that you mentioned? If you can either mention the name, and then we can put in the chat box for those who are interested in this book.
Sure, sir. The name of the book is Educate, Don't Medicate. And Don't Medicate by Dr. Brian Sheen.
Brian Sheen.
Yeah. He was located.
There are several comments here coming for appreciating your mention of Kumar Kalyanaras.
Yes, sir.
It is a controversial thing because people here are frightened of bhasmas, and this is a complex yoga of many different bhasmas. And your mention of this is deeply appreciated in the audience here.
Thank you very much, sir. Really appreciate it. I'll catch up later. All my stalwarts are sitting here, and with all their inspiration, only I've been able to hold the flagship of Ayurveda, took it to 27 countries, sir. I probably feel, that has given me recognition, and thanks to Ayurveda.
Please continue to stay connected with this platform, Ji, because your leadership is what guides us as we progress.
I will, sir. Thank you
Namaskar.
so much.
Wishing you, your mother, a safe recovery to good health. Namaskar. Ji.
Thank you.
We're very happy to have here with us Rajagopala Ji. Rajagopala Ji, namaskaram, vanakkam. Unmute, please, Ji. We're very fortunate to have you here with us today, representing both yourself, of course, and the All India Institute of Ayurveda. We are very happy to have Prajapati Ji also here, and we look forward to learning from you, sir. Thank you for joining us today. Once again, I hope you will continue to stay connected with us and guide us in our journey as we progress. Welcome to the platform, Ji. Pavanji.
Welcome, welcome, Dr. Rajagopala ji. Welcome.
Namaste.
Namaskar.
Namaste. Yes. Sir, should I start?
Please, all yours, Ji. All
Yeah.
yours.
I want screen share. So can somebody tell me my screen is visible, sir?
Yes, it is visible. If you can put it to presentation mode, then
Yeah, I'm going to it. Yeah, now?
Yes, thank you, Rajagopal. Very clear. Thank you very much.
At the outset, my thanks are due to Dr. Vaidya Pavan Sharma ji and the team. They're conducting this webinar since the pandemic struck the nation. And I think this is 461 session of the Independent Ethics Society webinars. I had chance of addressing these webinars earlier too, in two different occasions about childcare in Ayurveda, and one more was about Swarna Prashana or gold-based administrations. And today the presentation is about cerebral palsy in children. My background is I'm a postgraduate in Kaumara Pratya, that is Balroga from Gujarat Ayurveda University. And then I had a short period of service in Karnataka colleges. Then again, I entered Gujarat Ayurveda University as a faculty. For about 15 years, I was there. And after that, I joined All India Institute of Ayurveda. And since last 6-7 years, I am at Delhi with the Department of Kaumara Pratya. My journey in cerebral palsy started way back in 2008 onwards, where the initial works on management of cerebral palsy in children started. So I'll be sharing my experiences along with the approach what we are following it at All India Institute of Ayurveda. As you know well, this is an apex institute under the Ministry of Ayush, an autonomous body, and having an ABH accreditation and NAC accreditation we are going to have now. It is a 200-bedded hospital facility with the 25 specialty departments and 8 interdisciplinary research laboratories. Fortunately for the Department of Balaroga or Pediatrics, Ayurveda Pediatrics, we have got an independent OPD, we have got independent wards, and we have got a very important thing is independent Panchakarma theatre, where exclusive pediatric cases are managed. And this is our strength in managing cerebral palsy. Coming to the activities of Department of Ayurveda Pediatrics at All India Institute of Ayurveda, we have a specialized Panchakarma unit, as I said. We have a neurodevelopmental unit. We have a respiratory center. We have immune clinic and vaccination center for the children. We have a IPD section where 10 beds are exclusively dedicated to pediatrics itself. And in addition to that, of course, we can admit our patients in general as well as special wards of the hospital. Immunity vaccination clinic, I said already. We had a small study on Swarna Prashana also as part of PG dissertation work. We have advanced Ayurveda neonatal care unit. In other words, it is the NICU, neonatal intensive care unit. We have just started with it, and research labs. Recently, we are going to start, or we are on the way of starting an informatics or bioinformatics laboratory also under the heading under the purview of Ayurveda Pediatrics Department. Coming to the neurodevelopmental unit of the hospital or of our department, what we are attending more frequently is cases of cerebral palsy. Of course, we get good number of patients with cerebral palsy to our OPDs. ADHD, ASD, that is autism spectrum disorders, intellectual disabilities, including mental retardation, dyslexia, and such type of cases. Every day we used to get at least 2 or 3 cases of these categories, which where our brain matrix is involved. As you know well, Professor Akhilesh Sharma ji has very elaborately explained his experiences along with the modalities and the drugs what he is using. Of course, we are also using almost all the drugs which have been mentioned by him. Cerebral palsy is one of the very devastating condition to the family as a whole, not the child alone. You should see the mothers particularly, because it's more affecting the mothers. how they are dealing or how they are taking care of the child and how much they suffer. So every time when we see that, we feel that we are not able to do anything. It was earlier our notion that cerebral palsy cannot be, it cannot be cured, of course, the quality of life cannot be improved. But over a period of time, for the last 12, 13 years of experience in dealing with such children, now we are in a position to say that no, the quality of life definitely can be improved. Cognitive components can be definitely improved. And also, to a major extent, the motor disabilities. Of course, there are certain conditions where already structural deformities, if they have taken place, and there is no scope, particularly for the spasticities, there is no scope of further relaxation of the contracted tendons and muscles, then we will have to resort for certain corrective surgeries. But surgery is not the ultimate, because we are getting children who have undergone rhizotomy and other things, who have taken the muscle relaxant injectables with recurrency, or what you call as with no much relief. There is no single cause for cerebral palsy as such. I am not going to the details of the theoretical aspects of it. Our focus of management is function, family, fitness, friends, fun, and future. That's 7 Fs we are using. And these all Fs are taken care, are to be taken care when we are dealing with such cases. If you come to the hospital at Jamnagar, there is a separate unit called as for the children for relaxation and fun and friendships. We have got a toy room, we have got a entertainment room specifically for this. And there are a good number of patients in Jamnagar also, where I started my career as a faculty. Coming to the Ayurveda concepts, as Professor Akhilesh ji was deliberating, it is a Vata predominant condition with involvement of other two doshas. Pitta and Kapha are also involved. And if you see more specifically to the conditions, if the spastic cerebral palsy and dyskinetic cerebral palsy type of cerebral palsies, they have more of Vata predominant presentations, but we get a small number of patients where Pitta Kapha involvement are also seen. However, the damage is to the brain, damage is to the motor system, nerves, and that has to be corrected. So the multidisciplinary approach in what at our place, what we are doing is, of course, Ayurveda consultation is there, special Panchakarma facility is there for children, specific medications are there. As Sharma ji was telling about Kumara Kalyana Rasa, because of the cost factor, we are not going much to the Kumara Kalyana Rasa or gold-based preparations, but wherever possible, wherever patients are affordable, we are using Yogendra Rasa, we are using Kumara Kalyana Rasa also internally. But our approach is more towards Panchakarma-based management. Physiotherapy unit, we have occupational therapy, we have orthopedic department, we have where the dietitians services are available. Shalakya department for the ophthalmology, eye, ENT related issues, speech therapy, nursing care. We have central investigation laboratories, radiology facility, and other things. That means composite all facilities are available. With that, we are able to give good relief to the patients. Now we are in a position to say that yes, if they are undergoing Panchakarma based management of cerebral palsy, 15 to 20% relief can be achieved within a period of 3 months. Of course, the parental cooperation, family cooperation is a must here. Our management algorithm goes like this. When child is coming with the signs and symptoms of cerebral palsy, we take them to the neurodevelopmental unit, where multidisciplinary team assessment will be done, and after that risk factor assessment is done. Red flags, if at all anything is there, most of the times we come across with seizure disorders with this type of kids. Seizure disorders, sometimes they are refractive in nature, they are not responding to 1 or 2 anti-epileptic drugs, they go for higher number of drugs. That again worsens the condition. In such cases, we take referral opinion and investigations and further management as the child requires, it will be done. And with the classical cerebral palsy features, yes, we go for Panchakarma based therapies. The first line of approach is this classical Ayurveda approach, where we do Amapachana, Deepana Pachana Karma is done first, Koshta Shuddhi is done, and then after that we go for Panchakarma therapy, where Purva Karmas are done, followed by Pradhana Karma. Of course, Paschat Karma is part of all these things. Along with that, some internal medications, because of the availability of medicines, as well as because of the economic status of parents or family, there are much restrictions in the internal medications. However, with the available medicines and with the available facilities, we are able to give much relief to the child as well as to the family. The aim of therapy, main aim of our approach is manage the primary conditions, prevent and manage complications, associated conditions and co-mitigating factors, control the pain factor, optimize the mobility, maximum communication possible, maximum learning potentials, encourage social and peer interactions, foster self-care and promote life skills, maximize independence and self-sufficiency, and enhance quality of life and well-being. This is the final target of us. These are the Panchakarma-based procedures we are doing. Udvartana. Udvartana is a procedure which has multidimensional approach or multidimensional therapeutic application, where Deepanapachana is also done, Rukshana is also done, Sroto Shodhana is also done. So in all our cases, first line of treatment is Udvartana, irrespective of type of cerebral palsy. We do Udvartana for 3 days to 5 days, in some cases 7 days also, looking into the Koshta. Rukshata, if develops, that one indication of developing Rukshata is constipation. If Rukshata is developing, immediately we stop it and we go for the next line, that is Sarvanga Abhyanga and Nadi Sweda. Nadi Sweda, many of the times, depending on the age, if small kids are there, we are doing Nadi Sweda. If the child is able to follow the commands, then we will give Sarvanga Sweda with the Bhashpa Swedana Peti box. Shiro Abhyanga is done. Shiro Pichu is also applied. Nasya is another management we are adopting, and in the cognitive component of development, Nasya plays a very vital role. Shirodhara, where dyskinetic type of patients are there, and little elderly children, where we go for Shirodhara, otherwise we go for Shiropichu. Shastikashali Pindasveda, Vata Pradhana, and Krisha, in such conditions where Snigdhata, Sneha Swedana, all three things are together required, there we go for Shastikashali Pindasveda. Generally, our treatment goes like this: Udvartana followed by Abhyanga and Sweda for 7 days. And in the course of 7 days of Abhyanga Sweda, we advise Matra Vasti from the 3rd or 4th day. The purpose of giving Matra Vasti is Vatanulomana and Koshta Shuddhi. And after that, we go for Basti. We have tried in different cases, different types of Basti modalities, like we have schedules of Basti, Kala Basti, Karma Basti, Yoga Basti. That is number of decoction-based enema. How much number is that? Based upon that. And there is another specific Basti schedule mentioned by Kashyapa Samhita, which is an authority of Ayurveda pediatrics. That is Chaturbhadra Kalpa Basti, where initial 4 Sneha Basti is given, and next 4 Kashaya Basti is given, and next again followed by 4 Sneha Basti. The total together it becomes 12 Bastis. This is also we have tried, and what we have seen is there is no much difference in all these Basti applications. Definitely Basti helps, but the result, if you analyze, almost all neck to or hand in hand response we are getting. Matra Basti, of course, we continue even after completion of Panchakarma therapy, after Samsarjana Krama. We teach the mother particularly to how to administer the Matra Basti, and we advise them to continue it. And that helps a lot in Vatanulomana and control of whatever improvement is the child has achieved. The assessment and outcome measures of cerebral palsy, generally what we are doing is history observation is a routine thing. Assessment of reflexes and reactions, assessment of functional level and motor development, that is GMFM, that is gross motor function and measurement. There is a scale, established scale, and this scale we are using for that. Assessment of muscle tone also we are doing with the Ashworth, modified Ashworth scales, and range of motion also assessed with the help of goniometric reading. Then assessment of muscle strength, assessment of physical fitness, assessment of gait. All these things are done prior to starting the therapy. And after the completion of the therapy, usually it is of 21 days we are doing it. And after completion of the therapy, this is reassessed, and the patients are asked to attend for therapy once again after 3 months of duration. The reason of 3 months of duration is when whatever they are achieving, the result of Panchakarma therapy, it takes around 2 to 3 months time. And then once again, the same thing is repeated. Internal medications are varying depending on the condition of the child and requirement of the child. Sometimes Medhyarasayanas are used, sometimes simple Vatahara drugs are used. Kumara Kalyan Rasa is one of that where possible. Samira Pannaga, Ekangavir Rasa, Yogendra Rasa, Vatavidhamsa Rasa. These are the rasa preparations we are using. In addition to that, we are using Vatahara herbal powders also. As Dr. Akhilesh was telling about Brahmi, of course, Brahmi increases the blood circulation also. And Brahmi Ghrita, Brahmi Churna form, as well as the aristas like Saraswata Arista, Ashwagandha Arista, Bala Arista. These things are, that is again patient dependent. Procedures, mainly we are following as I have told. So this chart is just showing the gross motor skills, manual abilities, assessment of balance, assessment of health related quality of life, and babies high risk cerebral palsy as early as 3 to 5 months of age. General movements assessment is in babies of 20 weeks or above. Yes, 95% predictive and neuroimaging and other things are done. Treatment considerations, type of CP, age of the child, associated impairments, and part of the body affected. Looking into all these things, the modality what has to be done, that is selected. This is our observation in the motor types. Spastic is 80 to 90% we are getting. Majority of the patients are spastic type, where definite improvement is seen. A small percentage of dyskinetic CP we are getting. Dyskinetic CP response is slow to the treatment. However, initially I was feeling that dyskinetic is difficult to manage, but it is not so. If you are using modalities like Nasya along with other Panchakarma, Basti and other things, yes, dyskinetic also responds, but a little slow. Ataxic 5% we come across with, again here, ataxic type, the response is even slower than dyskinetic type. Mixed type is always a challenge for us. Of course, if parents are having patience and repeating the procedures, what we are advising, and over a period of 2 to 3 years, yes, there is development. This is something about the theory part of it. I think my next speaker will be speaking on this. Associated impairments, walking disability, talking disability, pain, epilepsy, behavioral problems. Already Dr. Akhilesh has spoken. I'll not be going to the details of this. Treatment considerations, yes, these are the requirements children have, but it varies from person to person, patient to patient. So depending upon that, we are modifying or we are adjusting the treatment modalities as well as internal medications. Our research initiatives, as I said, I'm going to present one study here, and which we have conducted from 2016 for 2 years at our hospital. 2008 onwards, I'm working with my students on cerebral palsy, where we have seen that the Panchakarma-based, therapy-based treatment is must, along with the Medhyarasayana or nootropic drugs, which are Vatahara also in nature. Metallic preparations or higher metallic preparations, definitely they give better response, but the only question is, one is the toxicity component, whether it is properly prepared or not, we're not very sure of it. And because of fear of that bhasmas and other thing, it is still there, it is also there in India also now. And because of that, we are restricting ourselves to the use of that. Kumara Kalyan Rasa or gold preparations, even simple Swarna Prashan also we are advising, and wherever possible. Yes, it is giving good response. Till now, of course, we have completed 3 clinical trials at our hospital, and 1 trial is going on now, and 1 more trial is in the process of finalizing. This is one study, determination of efficacy of Abhaya Ghrita, a process and procedure-based therapy in the management of cerebral palsy. And the publication is also there on this particular work. The primary objective of the study was to determine the efficacy of oral administration of Abhaya Ghrita. Abhaya Ghrita is a polyherbal formulation which contains Medhya drug in it, Brahmi, as well as there are certain Deepana Pachana or digestive metabolic corrective drugs. Procedure-based therapy in the management of cerebral palsy. Procedures, what we have adopted, I will be elaborating. Inclusion criteria, age 1 to 12 years of age children were taken in the study, and parents were ready to give the consent for the study. Exclusion, progressive neurological disorders we have excluded. Suffering with any other systemic illness we have excluded. Comorbid intractable epilepsy type conditions we have excluded, and other surgical and other conditions. The design of the study was interventional. Purpose was treatment. Masking was randomized, and it is open label study because procedure-based studies, blinding is very difficult. So we didn't do any effort on that. It was a two group study where we had a control group also. The control group received physiotherapy and the trial group received the drugs. The results are shown here. In laying, rolling, sitting, we found a good significant result. In total score, if you see all together in GMFM scale, it was significant, statistically significant. Forget about the statistical part of it. Clinically, what we have observed is the patients are coming again, and the children who are brought on hand or who are brought on wheelchair, they are going by walking after a period of say 2 or 3 sittings. They're able to have achieve more motor control, as well as the patients were, of course, in this study we have not done Nasya. The study where Nasya was given, cognitive improvement was also there. The other parameters also we have studied, and in all parameters, if you calculate, about 17.49% improvement in quality of life scale, as well as 78% improvement in gross motor function scale was observed in this particular one study. This is the flow chart, how patient enrollment was done and how the study continued. 40 subjects were enrolled, and an analysis was done about the study, and the outcome is published. Treatment protocol, as I said, in this study we had used Udvartana for 3 days with Tilapinyaka Churna. Tilapinyaka Churna is a paste, or the, what you call the remaining part after expression of oil in the tila. It is a Ruksha Dravya. Fine powder was made and it is heated, and then it is used for Udvartana Karma because of the Ruksha nature. Sarvanga Bhyanga Nadisveda was given and Matravasti was given here. Along with that, internal medications were given. Abhayagrata was one of that, and the study was registered in CTRI2. 3 courses of treatment was given in this particular study. In the later part of the second and third study, we have given 2 courses of treatment, and the Nasya and other Basti and other modalities were added to it. You can see overall response of the therapy, mild to moderate response. Mild response was found. Overall clinical improvement in the therapy also you can see here in this chart. As I said, nearly 20% improvement was received or observed in motor aspects of the patients, and in the quality of life, 19% improvement. There is an error here. Sorry for that. Further, one more study was conducted. It is just submitted, and the work is completed, and the thesis, the results are just submitted, where Sarvanga Abhyanga, Matravasti, and Dashamula Nasya was given with Panchendriya Vardhana Taila. Of course, Indriyas, the sense organs, with the controlling part is the brain, and Panchendriya Vardhana is improving all the 5 sensory organs. And in this study, again, we found the same, or even a better response in the patients. These are all the study outcome I'm showing here. And this photograph is very famous. When the WHO Director General Tedros visited our institute, he interacted with our patients. It was criticized also at some level, because they were the person who were criticizing, they were not aware of what Ayurveda is. It was a blind criticism, and the child was responding to him, and he was interacting with the child. Earlier, he was not responding at all. And when he visited, the DG visited, at that time, second course of treatment was going on. And the overall, what I want to say is, if judicially applied, These are the words of Director General after interaction with the children. He visited our ward, he visited our Panchakarma unit also. And after that, in every speech what he has given at our institute as well as in Gandhinagar during the Global Investment Summit, he quoted the department and department activities. This is of course what you call compliment we have received for the work we are doing. And there are a lot of such recordings with us where children who are not able to sit, who are not able to hold their neck properly, achieving the neck holding, achieving walking. Guide may not be very proper. It will be a dangling guide, of course, but they are able to stand, they are able to balance themselves, and they are able to take few steps. These improvements can be achieved in a very short period, and repeated sittings are to be given. Of course, by seeing the improvement in first sitting, second sitting, we cannot put the child into continuous Ayurveda therapy also. We should give time to recover, because all Panchakarma procedures are tedious procedures, and the immune system also becomes weak. But this is what we have again seen. When we are giving Panchakarma therapy, some children, they get fever, they get infections very quickly. That also to be taken care of. This part is taken care of by internal medications. The drugs of Medhya nature or nootropic nature are immunomodulatory also, and they take care of the immune system, immune reactions, and other things. So with these words, I just stop my presentation here. Thank you very much for your patience hearing. Thank you very much, sir. I'm open for questions at the end.
Thank you.
Thank you. Thank you very much. Rajagopala, I don't know if you will be staying with us for the rest of the webinar, because there are many questions coming here and we want to keep the flow going. Will you be, I hope you will be able to stay with us to take a few questions.
Yes, sir.
Thank you so much. Thank you for this wonderful presentation. You have given a lot of details and several questions are coming up here. We will raise that as we move into the question answer session. We move on to our third speaker, and Pavanji will introduce Aswathi. Aswathi, namaskaram.
Thank you very much, sir. Dr. Aswathi P. Murali is Assistant Professor in Coimbatore Ayurvedic College, Department of Kamarvratya. I would like to welcome Dr. Aswathi, and I didn't introduce Rajagopala ji because he is so renowned faculty in Ayurveda, needs no introduction at all. So welcome Dr. Aswathi, welcome.
Thank you so much, sir. Am I audible, sir?
We can hear you clearly. Thank you.
Thank you. So respected eminent personalities who are present here, the respected audience, a very good evening to one and all. First of all, I would like to thank the organizers of AYUSH SAMRIDDHI, especially Dr. Pavan Kumar sir, for giving me the opportunity to be as a speaker here. Thank you so much. And also,
Aswathi, there is a comment coming here saying your voice is a little low. Is that because of the microphone, or is it? Could you try talking without the microphone? Maybe it will be better.
Sure.
That's much better. I think it's the position of the microphone. I think.
Yes, sir.
Much better. It's much better now. Thank you.
Okay. Thank you, sir. Then I will continue like this.
Thank you.
So I'm so happy to hear the eminent words by Dr. Akhilesh sir, Dr. Rajagopala sir. So thank you so much for the wonderful sessions. Without delay, we can move on to the session. Shall I take some time, sir, or whether I need to complete it fastly? Madam,
Nope,
sir.
take your time. We want to learn from you, so please take your time.
Okay, thank you. Thank you so much, sir. So let me share my screen. Is it visible, sir?
Looks very good. Thank you very much.
Thank you, sir. Om Shri Dhanandare Nama. So today I'm going to present some of the viewpoints of cerebral palsy and its management as per Ayurveda. But before moving on to it, let us rewind some basic concepts of cerebral palsy as per the modern view for better understanding. So some of the background regarding the cerebral palsy as a disease. So actually the modern cerebral palsy history, which begins in the 18th century, that is Dr. William John Little, is recognized as the first person to study the cerebral palsy as per the research basis, and he defines it in 1853. And after his research findings, he presented it over the Obstetrical Society of London, stated that the children with cerebral palsy have an injured nervous system, and that will result into the spasticity, the main symptom we can find in the cerebral palsy. And this is the first recorded definition of spastic cerebral palsy. And that time it was called by the names like Little's disease and also the cerebral paralysis. And later in 1887, Sir William Osler, he wrote a book entitled Cerebral Palsies of Children, and it coined the term cerebral palsy. And based upon the cause of the disease, there are different opinions. So as per Dr. William John Little, he postulated that the birth asphyxia, actually it is resulting from the difficult childbirth, which is in turn results into the oxygen deficiency and brain damage. And this will occur after the birth of the baby. So as per the Dr. John Little, he only explained the cerebral palsy cause which occurs after birth. But later, Dr. Sigmund Freud, he stated that the cerebral palsy also can be caused by the abnormal development of the brain before birth itself. So he added the antenatal causes of cerebral palsy also. And regarding the World Cerebral Palsy Day, so the Cerebral Palsy Alliance established this particular celebrated day, that is World Cerebral Palsy Day, in every year October 6th, that is from 2012. And this year in 2022, the Cerebral Palsy Day is marked the 10th year anniversary of this celebration. So this is actually for inviting everyone to come together to find more accessible technology, that is more accessible management or the solution for cerebral palsy. And the purpose of this particular day is nothing but to create a world where the cerebral palsy people can enjoy the same rights and opportunities as that of others. Let us discuss some of the facts regarding the disease cerebral palsy. So nowadays, the cerebral palsy is a well-known condition, and this is the commonest motor disability in the childhood period. And when we correlate the cerebral palsy, or when we explain the cerebral palsy, it is not a single disability, but it is a group of disorders that affects a person's ability to move, to maintain the balance, as well as the posture. So apart from the movement related main problems, the associated features that will vary from person to person based upon the pathology, underlying pathology. So the clinical manifestations based upon the pathology, we can see in a patient in the entire body. So by the medical term cerebral palsy, it can be discussed as a label rather than a diagnosis. And when we consider the prevalence rate nowadays, in India, it is 3 among 1,000 live births. And the recent studies has been estimated that over 25 lakh children and people in India are with cerebral palsy. And in worldwide, 1 in 4 children with cerebral palsy cannot talk or cannot walk, or those having with epilepsy related complications in their throughout life. So these associated complications, it will worsen the prognosis, even the quality of the individual. This is the bad thing regarding the cerebral palsy. And definitely, it is a lifelong physical disability which develops only in a child. So the pathology only occurs during the antenatal, natal, or postnatal period. An adult cannot get cerebral palsy in later ages. And in cerebral palsy, the motor disability is the prime feature, but likely to develop other impairments according to the brain damage. So clinically, if we take the gender-wise, then it is more common in boys rather than in girls. And the major risk factor is considered to be the preterm birth. So why this particular gender difference for the occurrence of cerebral palsy? It is actually uncertain. But some studies postulates like the male born very preterm are appeared to be more vulnerable to the white matter injury and also the intraventricular hemorrhage than females, which is the most commonest cause nowadays for cerebral palsy, especially spastic one. And also the experimental studies indicating some of the sex hormones, for example, like estrogens, these will provide the protection against HIE. So HIE is nothing but the hypoxic ischemic encephalopathy, which is the basic pathology occurring under this particular disease. So the HIE usually we can see in the term babies where the brain damage due to birth asphyxia, it will result into the oxygen insufficiency. Again, it leads to the brain damage. So the same estrogen-like sex hormones, it is postulating like they will provide some protection against this birth asphyxia or HIE, and also the neonatal brain is also influenced by these hormones. So maybe due to that, it is more common in boys than in girls. So next is the definition of cerebral palsy. So the term cerebral means which is related to brain, and palsy means which refers to either the weakness or the problems with using the muscles. So any of the damage to the brain which will affect a person's ability to control the muscles may manifest as cerebral palsy. And the latest definition of cerebral palsy refers as a group of permanent disorders of the development of movement and posture causing activity limitation that is attributed to non-progressive disturbances in the developing fetal or infant brain. So there are some of the specific words. So one is, it is a permanent disorder. So it is static. So once any injury to the brain occurs, it will remain as the same and it won't be progressive in future. So this is one of the differential criteria of cerebral palsy from other neurodegenerative disorders. For example, in leukodystrophies or lysosomal storage disorders or mitochondrial disorders, etc. So that might initially mimics with the cerebral palsy, but there the condition worsen over time. And next is the development of movement and posture causing activity limitation. So the diseases of development of movement and posture causing activity limitation. So the motor function related problems are very common or the basic clinical features in cerebral palsy, like motor milestones delay, problems with muscle tone, strength, abnormal reflexes or coordinations, etc. And next is, which is non-progressive disturbances of the developing fetal or infant brain. So once the brain got injured, it remains the same. And accordingly, the manifestations clinically be present in that particular patient. So definitely, early diagnosis has been offers better outcome or better prognosis and also better quality of life here. So usually the diagnosis we can make often in between the 12th and 24 months of age. That is within usually first year or second year, we can diagnose the particular patient with cerebral palsy. but it should be based upon the combination of history taking, then presence of risk factors, abnormal muscle tone, abnormal reflexes, then presence of developmental delays, poor feeding, postural differences, etc. So also one of the main thing is we will get the persistent primitive reflexes, for example, like Moro's reflex, tonic neck reflex, etc. that pointed towards the nervous system pathology for the cerebral palsy. So next is the etiology. So moving on to the etiology, the basic pathology is related to either the abnormal brain development or damage to the developing brain. So the antenatal, natal and postnatal insults to the brain in an infant results into permanent damage, and that will giving rise to the disease cerebral palsy. So there are so many causes are there, like prenatal causes including prematurity, low birth weight, maternal epilepsy, hyperthyroidism, infections, incompetent cervix, toxemia, eclampsia, bleeding in the third trimester, etc. So actually we know in the intrauterine period or during the pregnancy time, the human brain development usually begins in the third gestational week, and it is occurring from the neural progenitor cells of the neural tube. That is already understood. And in the case of CP, why we are asking the pedigree analysis, or what is the importance of the family history? So we know that for this particular human brain development, there should be multifactorial input. So definitely the brain development is contributed by the events of the gene expression along with the environmental input. So both of these are essential, like the genetic background and the environmental input. So multifactorial. This is essential for the normal development, and the disruption of either any of these can fundamentally alter the neural outcomes. So that is the importance of asking the pedigree here. So definitely some genetic underlying factors along with the environmental factors are there for causing the particular brain damage. And moving on to the perinatal causes. Some of the causes I have quoted here, like prolonged or difficult labor, premature rupture of membranes, presentation anomalies, chorioamnionitis, that is especially the torch infections to the mother, intracranial hemorrhage, hypoxia, especially the periventricular leukomalacia, and also congenital malformations, etc. Definitely, it is the causes of birth asphyxia, which leads to the oxygen deprivation to the brain, and later it will results into the permanent damage of the part of this brain. So this is the basic pathology for the cerebral palsy there. And next is the postnatal causes. So the kernicterus, trauma, infections, any of the vascular causes along with metabolic disturbances in the infant, it will also result into brain damage, which will result into cerebral palsy. So next is the pathology. Apart from all these causes, definitely one more cause is nothing but the unknown factors, idiopathic factors, that until we cannot understood what all are the causes, in some certain patients, what all are the causes for cerebral palsy, it is lying as such unknown factors. So due to all these disturbances or due to all these causes, the pathologic events for cerebral palsy are: one is the periventricular leukomalacia, second is the parasagittal cerebral injury, third is the focal and multifocal ischemic brain necrosis, or the neuronal injury in the basal ganglia, and the selective neuronal necrosis. So all these are the pathological events we can find in each cerebral palsy patient. So the periventricular leukomalacia, that is peri means nothing but the around. So ventricles, nothing but the lateral ventricles. And the leukomalacia means nothing but the white matter. Malacia means the softening. So here, this is the particular and commonest cause of cerebral palsy, especially results into the spastic as well as quadriplegic cerebral palsy. Along with, it will be results into some of the visual and cognitive defects also. So this is nothing but a type of brain damage that affects the white matter of the infant's brain. Usually it will develop between a gestation of 24th to 36th week of gestation. So what happens means the bilateral white matter necrosis near to the lateral ventricles, it affects the nerve impulses that control the motor function. So this will affect and it will result into spasticity of the muscles. And one more thing is that why the preterm babies are commonly affected with this PVL, periventricular leukomalacia. So that is nothing but the easy damage occur to the immature white matter. So that's why the PVL is commonly seen in the preterm babies, which will result into cerebral palsy. And the second pathology is nothing but the parasagittal cerebral injury. So this commonly, it is a complication of HIE, hypoxic ischemic encephalopathy. Usually we can find in the full-term newborn babies. So here what happened means, usually the upper extremities are commonly affected, severely affected than the lower extremities if the parasagittal cerebral injury has been occurred. And the third is the focal and multifocal ischemic brain necrosis. So here the infarction. So the specific infarction will occur usually in the vascular distribution. So commonly we can see in the left middle cerebral artery. So it will result into either hemiplegia or seizures. And next is affecting the basal ganglia. So basal ganglia, we know it is located in the center of the brain. And it is a group of subcortical nuclei. So it is responsible for the voluntary motor control as well as the cognitive and emotional functions. So either any of the injury happens to the basal ganglia, usually it will result into the chorioathetosis or the mixed form of cerebral palsy. And apart from that, one more pathology we can describe like selective neuronal necrosis. So again, either in the lateral geniculate bodies or in the thalamus, or again in the basal ganglia, these lesions result into mainly the mental retardation as well as the seizures. So these are some of the pathologic events occurs mainly due to HIE. So asphyxia or birth asphyxia, which will result into the complications hypoxic ischemic encephalopathy. Later it affects the brain necrosis in that particular area, and according to that the clinical features or the types of cerebral palsy we will get in that patient. And next is manifestations in cerebral palsy. So when we will suggest a diagnosis as cerebral palsy in a patient. So usually if a person having delayed motor development, that is delayed milestones is gross motor development delay is there, along with muscle tone abnormalities, either hypertonia or hypotonia, along with the postural variations. These three important signs are suggesting a diagnosis of cerebral palsy. So definitely a careful neurological examination might reveal the asymmetricity in the muscle tone, strength, reflexes, posture, coordinations, etc. in a cerebral palsy patient. For example, if we are taking a baby having age before 12 months, usually we can find the occurrence of hand preference by the baby. So the hand preference, nothing but it suggests of the hemiplegia. So like that, according to the examination of the patient, we can find the diagnosis of cerebral palsy. And along with the motor disabilities, some of the associating features like mental retardation, ocular or visual impairments, behavioral problems, seizures, speech and language disorders, sensory impairment, feeding difficulty, these are the commonest associating features according to the pathology and which part of the brain is impacted or damaged by this pathology. And these are the early signs, that is age-specific early signs. Definitely, by observing some of the early clues, which is especially within 6 months of age of an infant, we can do the early diagnosis. So definitely the early diagnosis has been given the better prognosis. So in the infants before 6 months, these points we can find. Then that can be suggestive of cerebral palsy. So first point is cannot hold up their head when picked up from lying on their back, nothing but the neck holding. So usually it will attain within 3 to 4 months of age by a healthy baby. If above 6 months this is continuing, head lag is there, it can be suggestive of some neuronal abnormalities. Apart from that, the postural, either floppy or stiff posture should be there. And especially the cortical thumb sign, if it is prolonged beyond 4 months of age. So this is nothing but twisting of the hands, including the adduction and infolding of the thumb. So it is suggesting beyond 4 months, this cortical thumb sign is there. It is suggesting the brain damage. And apart from that, this inability to bring the hands together in the midline. This is also in the supine position. If it is static for more than 4 months, this is suggestive of again brain damage. Then the sucking, feeding difficulties, some of the behavioral symptoms like excessive lethargy, irritability, high-pitched cry, or sleeping difficulties, all are implies the brain itself under to that. And we can find some of the important gross motor delays, especially in cerebral palsy, like the head lag persisting beyond 6 months, and rolling will not be there by 6 months, then inability to independent sit straight by 8 months, and no hands, that is crawling, will not be attained by 12 months. These all are commonly we can find as gross motor delays in a cerebral palsy patient. So everything is suggestive, the diagnosis of cerebral palsy. And moving on to the classification, we know the basic classification are into 5: spastic, ataxic, dyskinetic, hypotonic, and mixed. So this is based upon the motor dysfunctions, and it reflects the area of the brain damage and also in which area of the body these manifestations will be present. So as no, spastic is nothing but the pyramidal tract injury. So it will affect the motor areas of the cerebral cortex. And this is the commonest type. And here it will result into the stiff movements. It is nothing but due to the high muscle tone. So according to the affected area, diplegic is there, hemiplegic, quadriplegic, monoplegic, paraplegic. So many types are there. So specific features we can find here in spastic CPS. One is the persistent primitive reflexes, and we can find the Babinski reflex as positive. Then due to the hyperreflexia, angle clonus may be there. Then the eventual development of the bone deformities or contractures we can find, especially the gait, scissoring gait, crossing over of the legs. We can find toe walking may be there, talibus may be there. And in the babies, we can find difficulty for the diaper changing. These all are due to the hyperspasticity. So each type of spastic CP, different manifestations may be seen. And the ataxic CP as well as dyskinetic CP are coming under extrapyramidal manifestations. So here the lesions either may be in the basal ganglia or in the thalamus or even in the cerebellum. So the main function of this extrapyramidal tract is nothing but it will maintain the posture and it will regulate the involuntary motor functions. So if the injury happens to this particular thing, according to that, the symptoms may be vary. For example, in ataxic CP, we can see the wide-based gait. Then the baby cannot do the rapid and repetitive movements. Then disintegration of the upper extremity movements. All we can see, especially in the ataxic CP. In the dyskinetic CP, the athetoid and the chorea movements are the characteristic features here. So we can find in the baby with involuntary movements, irregular movements, jerky movements of some of the parts of the body, like even in the extremities or trunk or neck or facial muscles, tongue, etc. Apart from that, again, the dystonic face or the abnormal posture should be there. Along with here in the dyskinetic CP, actually the involvement of the pharyngeal and oral muscles should be present. So associated to that, the drooling should be there, along with speech difficulties like dysarthria, etc. we can find in the dyskinetic CP patients. And definitely the hypotonia, so decreased muscle tone, the floppy baby we can see in the hypotonic CP. And in the mixed type, we can find the mixing of all these symptoms. Apart from these 5 classifications, again types are there. For example, based upon the GMFCS, that is nothing but the gross motor function classification system. So 5-level classifications of cerebral palsy based upon the gross motor abilities as well as the limitations. So that is another classification. So anyway, as per the modern the diagnosis should be based upon the physical examination, the history, the neurological assessments, then some of the criteria like Levine criteria, etc. And apart from that, we can use the electroencephalogram and the imaging techniques like CT, MRI, etc. And also the additional tests for the associated complaints. And the management, as per the modern, we know it is a combined interventional management, including the physical, occupational, pharmacological, speech therapies, and some of the surgical interventions like rhizotomy, etc. are there. And the recent advance is nothing but the stem cell replacement therapy. So we can isolate the stem cells from the bone marrow, adipose tissue, etc. And the stem cell transplantation we are doing here. So all these management it will help the person to promote the functioning as well as it will prevent the secondary impairments. So this is actually a summary of cerebral palsy as per modern view with minimum explanations. But for better understanding, definitely each of the types we need to go in depth. So here we can stop the modern aspect and now we can move on to the actual topic, that is the Ayurveda perspective of cerebral palsy. So while considering Ayurveda, so it is totally a different system of medicine, definitely. The science based upon its own principles and practices. So we cannot compare a particular disease with Ayurveda from the modern concepts, definitely. But with Ayurveda, we can understand the disease cerebral palsy along with the other diseases in its depth, and accordingly we can manage the conditions. So before moving on to cerebral palsy in Ayurveda, I need to highlight two important quotations from our Samhitas. So first shloka is from Ashtanga Hridaya. It is told like, Vikara nama kushalo na jihniyat kadajana nahi sarva vikaranam namato asti druvastidi. So this is the shloka where Acharya Vagbhada explains that naming of a disease is not important and it is not mandatory also. But the duty of a Vaidya, a doctor, is to understand the condition or the disease in the right way, and by understanding the patient itself, he or she wants to provide the proper treatment that gives the patient some relief from the pain. And in Charaka Samhita, Acharya Charaka opines that the one which gives the arogya or health is the correct medicine, and the person who can relieve his patient from their ailments is the best physician. So, how we can understand the disease cerebral palsy as per Ayurveda? So, there is one term, Shiro Marma Bhighadaja Vata Vyadhi. So, here, Shiras, definitely we are considering as a marma, a vital part. So, any injuries or lesions happens to the Shiras, it will lead to dreadful complications, either any dysfunctions or even up to death. So in Harita Samhita, one quotation is there, Murdhani abhighadena yo jato na sa sadhya pratanakaha. So Haritacharya describes that any injury or any insult or any trauma that happens to the head or to the brain, it is not easy to cure and it will result into functional disabilities. So this thing only we are finding in the cerebral palsy, etc. development disorders. And apart from this Shiromarma Abhighadaja Vata Vyadhi, based upon the pathology, it can be either Sahaja in nature, there is nothing but this pathology, it is present at birth itself, and Jadaja. So occurs due to birth complications, for example, due to the injuries, asphyxia, anything. And also it is Garbhaja in nature. So pathology occurs at the time of conception itself. So due to developmental abnormalities of the brain or the agenesis of some of the parts of the brain, anything, it will result also cerebral palsy. What all are the contributory factors? Definitely the inappropriate Ritu, Kshetra, Ambu, Bija, the four important factors which will contribute to the conception. So any of these factors which is improper in nature then the conception will lead to disorders to the baby. And for example, due to the improper age or the improper time of conception or the diseased reproductive system itself or the impaired nutrition supply or the abnormal gametes. So all these will result into fetus with disability. Apart from that, the Dauhrada Avamanana. So the longings of the mother should be honored, since a definite bond between mother and fetus is there during the intrauterine period. And next is the presence of Garbhobaghatagara bhavas. So the factors which will result into improper development of the fetus intrauterine. So either the deeds or the diets or the regimens or some of the drugs, for example, the teratogen exposure, etc. Anything we can consider as the Garbhobaghatagara bhava here. And next is the incompatible Garbhavriddhigara bhava. So those factors which are opposite to the Garbhavriddhigara bhavas, or which gives the bala to the mother as well as to the baby. So using all these things, the incompatible Garbhavriddhigara bhava also contribute this type of marmabhighadajanya vata vikaras. And improper Garbhini Paricharya, definitely. Then one more thing is the delayed Prana Pratyagamana. So in Ayurveda also, under Navajata Shishu Paricharya, the resuscitation measures to overcome the birth asphyxia is told. So once the birth asphyxia we are managing, then it won't lead to HIE and further complications. And one more important thing is the balagraha. So definitely the infections either to the mother during the pregnancy period or at the time of birth to the baby, that will also result into the particular pathology. And all these causes, it will result into some of the conditions. So I'm quoting here some of the diseases explained in the Ayurveda, which are having the similar clinical features to that of the cerebral palsy. The first one is Fakka. Definitely, Kashyapacharya explained Fakka Roga. So there, till 1 year of age, again the developmental delay we can find. Then Pangu. Pangu is nothing but the Karma Hani. So there, the paralysis of the lower limbs due to the Matulunga Majja vitiation we can find. Then apart from that, Mukatwa, Jadatva, mentally retarded, Eganga Roga or Sarvanga Roga, Pakshaghada or Pakshavadha, Kambavada. So all these things, all these diseases are having some of the clinical features which are there in the cerebral palsy also. So everything are coming under the group of Vata Vyadhi itself. So how we can explain the samprapti of such developmental delays as per Ayurveda? So these are the nidanas, antenatal, either antenatal, natal or postnatal. What all are the nidanas? Definitely the Tridosha Prakopa will occur and it will affect the Garbhashya. So either it will result into the Garbhashosha, that is improper development of the baby or any of the parts of the baby in utero, or Akala Prasava. So either preterm birth, etc., or Kashta Prasava, that is difficult labor. So all these things, either Garbhashosha or Akala Prasava or Kashta Prasava, all these will result into the same delay in the development of cerebral palsy. So these will contribute the Garbha or the Shishu Uttamanga Dushti. So Mastulunga Majja or Dushti will occur. It will again result into Prana Indriya Mula Dushti. So two different clinical features we will find. So one is the motor related developmental delays. Another is related to the mental aspects. So Pranadi Vada Dushti will occur. It will result into either Mukatva, Pangutva, Badhirya, Drishti Vikriti, Pakshaghata, etc. And if it affects the Chitta Karma Vikriti, it will lead to the mentally related, cognition related problems like Jadatva, Anavasthita Chitta, etc. So all together, this is nothing but the condition as cerebral palsy. We can find all these clinical features in a vary from one person to another person. Then these are the Samprapti Khadagas. So dosha, everything. So Vada Pradhana Tridosha, especially we can find in the such developmental delays. So Udbhavasthana should be Pakvashya because it is Vada Pradhana, but the Vyaktasthana should be Sarvanga. And the Vyadhi Swabhava, definitely either it is Syapya or Asadhya. It is very difficult to cure, but we can manage it. So here, as per the contemporary medical terms, so what all are the the modern clinical features we can find in the cerebral palsy. The same also we can find in our Samhitas. So here I have quoted some of the clinical features we can find in the developmental delayed patients. So this is the Shiro Abhigadaja symptoms. So Rupas from Charakam Siddhisthana. Okay, Ardida, Chakshu Vibhrama, Cheshtanasha, Mukha, Gadgada, Lala Srava. Then from Sushruta, again Shiromarmabhighadaja symptoms including Mukata, Swaravaikrita, Arasagrahida, Badhirya, Gandhajnanam, and Drishtubhagada. Then again from Charaga Samhita, we will get some of the Vataja Nanatmaja symptoms, which is mimics with the particular developmental delays, including this Pangu, Khanja, Kubja, Vamanatva, Bahu, Shosha, Mukatva, Vaksanga. Then this Ekanga Roga, Sarvanga Roga, Pakshavada, Akshepaga, Anavastita Chittva. So everything we can find in the disease cerebral palsy also. And from Charaga Vada Pragoba Lakshanas, including Parvasankoja, Pralapa, then Akshijatru Kundana. So everything. So as per the cerebral palsy features, we can find so many references from our Ayurvedas. And one more thing, before going into the management, definitely we need to select the dosha involvement in this particular condition. So generally, we can consider the cerebral palsy as a Vata Pradhana Sannipadaja Avastha based upon the symptoms. And definitely for Vata Dushti, so either it is Anubandha Vata or Avarana or Aganduja. So either due to the Kopavastha or due to the Dhatu Ksheja Avastha. So anything happens as the pathology for Vata Prakopa. So if it is the underlying pathology is Shiro Marmabhighada, then definitely it will cause the Shira Snayu Kandara Shosha. So this is further, it will result into the clinical manifestations in the CP patient. So what is the clinical condition? You need to give the treatment accordingly. So here you can find the types of cerebral palsy. Spastic is there, ataxic is there, athetoid is there, hypotonic is there, mixed is there, and the specific clinical features also. So here I'm trying to explain like what all are the symptoms are present in the cerebral palsy patient, how we can consider based upon the dosha involvement. So if monoplegia is there, it should be Vyanavada. So these things we will get from the each types of dosha. From the symptoms we will get, then Pitta Sadhaka, Pitta Dushti, Shleshaka, Kapha Dushti. So these features we will get from Brihatrais on the context, the dosha involvement, that is dosha Dushti Lakshanas for each Panjavata, Panjakabha, etc. In ataxic, so here you can find mainly the Vada Kabhaja nature. So especially the Vyana Vata and Shleshaka Kabha here affected. So if it is in coordination of the movement, then Vyana Prana Vata and Shleshaka Kabha, again Vata Kabhaja condition. But it is hypotonic in nature, then involvement of all the three doshas like Pranavata, Sadhaka Kapha and Tarpaka Kapha involvement we will get. In the athetoid nature, again it is Kapha Vadaja in nature mainly. There the Tarpaka and Shleshaka Kapha, Pranavata and Vyanavata are including. If it is affected with the hearing loss or speech defects, it is due to the Udanavata Dushti. Hypotonia, that is Kapha Pitta Vadaja. So there we will get the symptoms associated with the Tarpaka Kapha Dushti, Sadhaka Pitta Dushti, Vyanavata Dushti as well as Pranavata Dushti. So over to this, what we can manage. So the management of cerebral palsy, how we can consider. So definitely the treatment modalities are same, either Rukshana or Snehana, Swedana, Shodhana, Brahmana, Rasayana, Medhya aspects. So symptomatic treatment. So according to the dosha dushti, according to the patient, according to the clinical features, according to the samprapti, we need to consider or we need to select the particular treatments to every patient. So Rukshana procedures, Shamana Aushadhis I have gotten here. The procedures are there like Udvartana, etc. Then Shamana Aushadhas, we can start with the Deepana Pajana with all these medicines. Okay, again Snehana procedures are there. For that, especially to this dosha involvement. So Kapha Vadaja, we can select either Vishagarbhasthalya, Bala, Taila, Sajraidala, etc. Pittavada conditions like Kalyanaka Krita, or as broad spectrum, even Dhanvandaram, Ksheerabala, anything we can select. Svedana, Svaidar Parishega, Nadi Sveda Upanaha. So we can select according to the patient. So Vasti Chikilsa as Yoga Vasti or Karma Vasti, Kala Vasti, or even Chadrabhadra Kalpa Vasti we can give. So some of the drugs I have quoted here for Anuvasana Vasti we can select, or Niruha Vasti, etc. These are some of the Chamana Aushadhi. So here again the dosha involvement basis I have quoted some of the kashayas like Ashtavarga, it is Vata Kabha Shamana, Avarana Vatahara, Maharasnadi, it is Kabhanavanda Vata, and along with the Brahmana effects, and Dhanandaram Rasonadi, so many. And some of the arishtas including Balarishta, Shugandharishta, Brahmi Vadi, Manasavitra Vadi. Then Sneha, again Balatala, internal intake of these Snehas. Then some of the rasa aushadhis like Smriti Sagara Rasa, Kumara Kalyana Rasa, Eganga Veera Rasa, Brahadvada Chintamani Rasa, some of the Bhasma preparations. Then this Kalyanaka Gula, Brahma Rasayana, Chavana Prasha, etc. has some of the churnas, especially Rajanyati, Balachaturbhadra Churna, Vacha Churna, Shankhapushpi Churna. So our treatment aspect is wide. So many medicines are there for us, but we need to prepare, or we need to pick or select the particular medicine to the particular patient according to our yukti. So definitely we want to know for this particular condition, what is the nidana, what is the samprapti, what is the dosha involvement. So based upon all these, along with the patient details, so based upon the vaya, Bala, etc., we need to select the medicine, also the treatment from this wide group of management. But points to remember is nothing but for cerebral palsy, especially the continuous or long-term use of medicines should be needed, and the repeated bedside-based procedures, and along with that, the multidisciplinary interventions we need. So what is the applied aspect of our Ayurveda Chikitsa in cerebral palsy or any of the developmental delays? So how we can explain it over to the public? So the new concepts like gut-brain axis theory. So this is nothing but the bidirectional communication between the central as well as the enteric nervous system. So nothing but the gut microbiota, which is having the actions upon the neural, endocrine, immune, etc. links. So what all are the medicines or treatments directly we are giving to the gut? Definitely it is having an action to the brain. So we can explain it based upon the gut-brain axis theory. Another thing is the myelin sheath and axon repair. So nowadays the studies postulate that the regeneration of the damaged axons is possible. So either any of the neurons are damaged, by the treatment, some of them we can regenerate. So this is one of the reasons that we are getting the results in developmental delays by using Ayurveda treatment and our medicine intake. As per the American Academy of Pediatrics, they have been postulated that delays or gross motor developmental delays, we cannot do anything with our management, it will not be improved, but how we are getting results as per Ayurveda. So this is the theory we can explain. Apart from that, the principles of stem cell therapy. So again, the studies explains like in our bone marrows or even in the brain, we have the neural stem cells. So these stem cells we can give rise to, by our medicines we can regenerate, and this will give rise to the new neurons, new astrocytes, new oligodendrocytes, and we can reverse the damaged condition. And definitely the action of Murdhini Taila and the Shiro Abhyanga massage directly to the Mastulunga itself, we are giving the medicine, and the Medhya Rasayanas. Definitely our medicines, the Medhya Rasayanas are having direct effect through the blood-brain barrier. So it will affect directly to the dendrocytes or the neurons, which will result into again the regeneration of the damaged cells, and we can reverse somewhat the condition, and we can give the better better effects to the life of the development delayed patient. So these are the other considerations. So these disorders also we need to think before considering the treatments. And one more important thing is the prevention. So how we can prevent the developmental delays. So many things are explained by our acharyas before conception, like the consanguinity explains Garbhadana Kala, preconception measures, so Masanumasika Paricharya during pregnancy, avoiding apathyas, and during the labor, the Prana Pratyagamana procedures, Jata Karma, Raksha Karma, Prakaradi Yoga, especially Medhya Rasayana, Lehana, so many things, including the Panchakarma procedures and physiotherapy. So in Fakka Radha, as physiotherapy, we can consider it as a physiotherapy technique, those who are doing for the improvement of the motor delays. So these are some of the preventive techniques explained in our Ayurveda. So by considering all these aspects according to the patient, according to the condition, we can select the measures. Definitely we can improve the life of these development delayed children. So thank you so much for the patient listening. Thank you.
Thank you. Thank you so much, Aswathi. You have given us a presentation that we will all be proud about, and delighted to have the recording of this presentation in our archive, Aswathi. So thank you once again. We are coming up to 9 o'clock. Aswathi, thank you very much. You have given us a very detailed introduction, and from both the sides, and some of the details, others, very specific details you offered are keeping us all excited and mesmerized. Some of the ways in which you have looked at the distribution, the different roles of the vatas, the different vatas, and how they are associated with different symptoms that you see. Now, please stay with us. There are many questions coming up in the chat box, so please stay with us, Aswathi. And we also have Dr. Rajagopala here with us. So the floor is open for discussion. The only comment I want to make at this point, before I give the floor to all who are here to raise their questions, the only comment I want to make is the prevalence of this, Aswathi. You are right in saying in India, the frequency is about 3 in 1,000 births. Here in the United Kingdom also, that is about the same number. 3 to 4 every 1,000 is the number expected here. So there are many, as Rajagopala said, you know, it is sometimes, or most times, very, very difficult for the family, particularly the mothers. And whatever help can be offered, if you can manage this, if you can detect the condition very early, there are many things you can do. The one question I have for you is about the marma points that you talk about, and whether there is a lot of any exciting work going on in Coimbatore, Aswathi, with understanding some of those marma damages or shiromarmas, etc. Is there something happening there? Would you like to comment before we open the floor for questions? Aswathi?
Sir, actually, when I'm doing my postgraduate, I done my postgraduate in SDM Ayurveda College, Udupi, in the year 2020. So there we got one patient with the agenesis of corpus callosum. So it is actually, they went for modern management for a long time, and after that they came. So the baby is having actually 4 years of age, but still he's floppy. Actually, he's lying in the bed. Any of the developmental, gross motor development will not attain till the 4th year. And definitely we are trying to give him better outcomes with our Ayurveda. And after 3 years of management, we get the good results. Actually, it is agenesis of corpus callosum. Definitely the features we can correlate with cerebral palsy itself. But after the 3 years of continuous management, either internal or IP management, now the baby can climb the steps. So that is the change. So whatever I told, as per the American Pediatrics Society, they already told that we cannot do any of the developmental delay cases. But how with our Ayurveda we are getting the results?
Very
So
good
much
question.
more research is needed in this field, especially in the developmental delays by Ayurveda measures, sir.
Aswathi ji, this is a question just to bring Rajagopala ji into our discussion, and also Vaidya Parul madam joining us from Gandhinagar, one of our senior mentors here. So Pranam Parul ji, Namaskar ji. The question for Aswathi, yourself and Rajagopal ji, are you planning to do a PhD, Aswathi? And is All India Institute of Ayurveda in New Delhi one of the places you are looking at to do a PhD in this work?
Yes, sure, sir. Actually, now I'm planning for PhD, sir. So
well,
actually, I need, because my PG studies are based upon Medhya Rasayana. So especially in IQ level. Actually, anyways, after giving the 3 months of medication, my medicine is Shankapushpi Churna. So there actually, yes, sir. So there actually, I got the best results. That is from the parents itself, they are telling like, they changed a lot with only this Shankapushpi Churna. So in my mind, we need some genetic based studies or with our Medhya Rasayanas. Then we can find out some things with our medications.
Thank you. Yes, thank you so much. I want to hear, perhaps Rajagopala ji might have something to add in reply.
Dr. Tangavelu, I'm here again. Am I audible?
Ji, namaskaram, manakam, sir.
We have in Jamnagar, of course, we had a couple of PhD work on cerebral palsy. And in All India Institute of Ayurveda, Delhi, now one of my scholars is going to work on cerebral palsy, multiple modalities of management in management of cerebral palsy in children. It is in the process. She is going to submit her synopsis in a couple of days now.
Rajagopala ji, my other question before we request Vaidya Parul ji to just comment on today's presentation. Rajagopala ji, you know there is the big initiative going on between India and the UK and the Great Ormond Street Hospital here in London. Would you be interested in engaging in extending this discussion like what Aswathi has provided, like what you have provided today, and what Akhilesh ji has presented? Can we come together to have a slightly deeper discussion so that we bring these two sides along with our colleagues in member states of the European Union? Is this something that you will be interested in?
Yes, definitely, sir. We have already initiated one dialogue with the cerebral palsy specific hospital at São Paulo, Brazil. There are already two rounds of discussions are over now. And we are open for benefit of children who are suffering, because I have seen mothers who are doing a lot of sacrifice. Grandmothers and grandparents are doing a lot of sacrifice, which of course, intolerable for a human mind.
Rajagopala ji, thank you so much for mentioning about thank you so much for mentioning about the ongoing interaction with Brazil. We will follow this up. I will follow up with an email, and if you wanted to share your telephone number on the chat box, then our colleagues who are here in this Zoom meeting will be able to discuss with yourself.
Yeah, definitely, sir.
Thank you, Rajagopal ji. We look forward to advancing this along with Aswathi ji and perhaps also Akhilesh Sharma ji. Thank you so much. Please let us hear from Vaidya Parul ji, and I can also see Naveen Gupta ji is joined us from London. Parul ji, pranam ji.
Pranam sir, a very good evening to everybody over here. Rajagopala sir, so happy to hear you after so many years. Aswathi ji and Sharma ji presented very nicely. It was a comprehensive presentation. I would like to add to it, Madan sir. Your question was on Marma therapy. So Brahmarandra and Shivarandra are the main points from where the oil can be absorbed, and that absorption results in proliferation of the brain cells, and that proliferation helps a lot. So whenever the child is born, in the Navajat Paricharya itself, Shira Pichu has to be put on the Navajata. So if we start with Suvarna Prashan, Shira Pichu Dharan, before giving the baby bath, if we are putting Bala Tel Apyanga and then giving bath with Sarvagandha Jala, then we are going to just rule out so many factors which may precipitate the baby into CP. We have been very lucky in having many CP cases, as Dr. Sharma Saab said. We used to have probably one new case every day, and we got cases from all over the world. And my interns had become so confident that they used to take a detailed history themselves, bring the case to me, and tell me that this child got CP because of these causes. The child is suffering from these problems. And now, madam, we want to give this type of treatment. We used to give more emphasis on Shashti Shalipindasved because that helps a lot in controlling the muscle tone. So Shashti Shalipindasved, and we used to use Mahanarayan Tel for Apyanga, and we used to use Maha Yograj Gugulu for internal use. We didn't give any Bhasma because majority of our patients were not affording, because it was a government organization. The patients, affording patients, even if the patients were affording, they were not willing to waste more money. They must have spent lakhs of rupees, but when they came to Akandanan or Vadodara or even Kolavada, they refrained from giving money for these medicines. So we used to handle them, and we used to give Mahayograj Google, and the drug of choice was Chandra Prabhavati. It gave wonderful result. It's a general tonic, it has diuretic action, and it helps regeneration. So all the way it gave Rasayan therapy. The combination of Mahayograj Google, Chandra Prabhavati, and this Harde, Haritaki, full drug, fruit of Haritaki. We used to make a paste of it and give to the baby. So that combination gave wonderful results. So
Parulji, thank you. Parulji, question.
CP cases can be handled effectively and not giving costly medicines when we have not given any bhasmas to them. Suvarna Jal, Suvarna Prashan, but our Suvarna Prashan was gold foil, and that used to help a lot.
Parulji, thank you so much. I'm so happy you have added to our details being discussed today. Perhaps I'm just putting some notes down as we go along. I can see a wonderful collaborative program coming up here between New Delhi, All India Institute of Ayurveda, and senior Vaidyas like Akhilesh Sharma ji, the Children's University there, Parulji in Gandhinagar, and All India Institute of Ayurveda, of course, and Coimbatore, and perhaps here in the UK, and also, as Rajagopala ji said, perhaps with our colleagues in Brazil and other parts of the world. Parulji, we look forward to your guidance to take some of this thinking forward. We will be in touch, ji. Namaskar, ji. Namaskar, ji. Thank you for adding to this discussion today. Rajagopal ji, we will come back to you, but I think Naveen ji wants to make a comment. Naveen ji, pranam ji. You have to unmute, Naveen ji.
I'm very, very happy to attend today, and I had already some question, if some expert can answer about it, that I would like to know more about the Fak Rog and Shosh Rog in context, in connection with the Ardita, which is the topic today. And if somebody can throw a highlight on it, but the presentation was very good, and I was just excited to show something, and then I will keep off now, and then I wait for Akhilesh, one of my very good friends for 30 years.
Akhilesh ji has left us today, Naveen ji.
I don't know why, but anyway. So I just want to show something to all of you on the screen now, that I have this time from India brought these Kailash leaves, which you will not see because I think you see now correctly.
Yes.
So these are the gold leaves, and this I am giving in London to the children.
Oh, so much.
As a Swan Prashan Sanskar.
Thank you. So,
So I'm very happy that Dr. Parul Joshi has mentioned it, and it's very, very good. And it's and many Indian origin people who are here in the West for a long time and even born here. So their children are born here. So they are very interested into that. And so I'm working very good on that.
Now, Naveenji, what is your question that you want to ask?
I asked in chat box. I would like to ask about the Fuck Rog, which you can say a little bit related to rickets, and this is also one of the reasons and of Digit by Stone. And I would like to ask that how Ardita is managed as per the Ayurvedic in acute management of Ardita. Because if I understand correctly, that for few days in the acute phase, as I did my rehabilitation medicine from All India Institute of Physical Medicine Rehabilitation, Mumbai, we were taught by our professors there already in 1986 that in the acute cases of any paralysis that includes cerebral palsy, we should not intervene at least for 7 to 15 days. In Ardita, they were a little bit not so hard, but other paralysis, they were very hard, about 15 days. That we should not make any intervention of any massage or any manipulation or any dry massage even. Forget about the oil massage, because everything is settling down. And in even polio cases, and after getting some permanent settle down after 2 weeks or 3 weeks, then we can start with Ayurvedic management. Otherwise, it is going to harm the patient. So that was very important for me to ask this question: what the Ayurvedic people in practice who are treating the Ardita patient, what kind of the experience they have while the Ardita patient comes to them, because they were coming to me in India, not here anymore. I've not seen any patient for last 1 year.
Perhaps we can listen. Perhaps Rajagopalji might be able to address this.
Yes, please, sir.
Can you hear me, sir?
Yes,
Hanji,
please.
we can hear you.
Yeah, okay. The first question is about Fakkaroga.
Yes.
Fakkaroga, actually, it is explained by Kashyapa way back in maybe 1,500 years back. It's a group of diseases. It is of 3 types, according to Ayurveda. One is of Garbhaja, Shiraja, and Vyadhi Sambhava. Garbhaja means intrauterine reasons. It can be because of IUGR, any fetal insult, or anything of that sort. Shiraja is because of nutritional deficiency, particularly. The text says that the pregnant lady feeding the baby, but pregnant lady we need not consider here. It is because of the nutrition deficiency. And third variety is Vyadhi Sambhava, because of the diseases. As a sequel of diseases, it can be infectious, it can be...
Rajagopalji, sorry to interrupt. Your audio signal is a bit weak. I don't know if that's the position of the microphone. If you could change it, then we will be able to hear you a little more clearly, sir.
Actually, I'm on the road now.
Oh, you're on the road.
Talking from the vehicle, yeah.
Thank you. Continue, sir. We understand.
One minute. And these are the 3 varieties which are mentioned in the text. And it is of course, any paralysis or any movement related, motor activity related issues arising in a child of 1 year. Child is not able to walk. It is a normal growth and development. We expect a child to walk, stand and walk by the age of 1 year. If child is not doing so, of varied reasons, that is called as Fakka. So it's a wide entity.
Thank you very much for that. Can you explain about acute management of Ardita? Means Ardita happens yesterday, and what you are going to do today?
So there are medical management for Ardita, as well as we have certain management protocols like Swedana and Nasya. This we are doing even in acute cases.
That you can do first day.
Yeah, definitely. Earlier the better. We can do it. If any other associated features or any other associated conditions are there, that has to be attended. Ardhita associated with paralysis because of the cerebrovascular accidents, if it is there, then yes, we have to leave the patient to settle down first, and then we have to start. But waiting for a long time is not advised.
What is the settle down period? What is the settle down period?
If hypertension is the reason for that, if aneurysm is the reason for that, if any bleeding is the reason for that, we have to manage it first. Along with that, once the patient is settled with that, then we have to start. No, we are doing it.
Rajagopalji, thank you so much.
Sir, if you want to hear more about Ardhita management in few words, Dr. Manjusha is with me. She is expert of Shalakya. She is managing exclusive Ardhita patients.
Thank you, Ji. Manjusha Ji, if you are free, Manjusha Ji, namaskar. Somehow the signal, you people are traveling somewhere and the signal is very weak.
It's because of rain actually.
Yes.
It's raining. So we can do Shamana Nasya, like pitta pacifying drugs if we take like Chandanadi tail, or if nothing is available, or Durvakrit we can use, or even Anupe we can use for Nasya. If we don't find any intracranial pathology, in such cases of paralysis, we can, or efficient palsy, we can use Nasya and Papa Kashayas for internal use, like Dandanayadi Kashaya or Pathyakshitatya Kashaya for internal use is to be given.
Can you write this? Can you write this chat box, please?
It might be.
And also your numbers.
Now it is a bit difficult.
It might be difficult, but please.
I'm on Android. Yes.
Let us connect.
Also your number. Also your numbers, please. Telephone numbers, please.
We can.
We'll try.
Thank you, Rajagopalji. The floor is open for any more comments, questions, suggestions. Navinji, we will follow up with Rajagopalji and Manjusha-ji at All India Institute Ayurveda in Sardavihar. We will follow up with both emails and telephone exchanges with both of them.
Madan sir, I like to add.
Hanji, please. Parulji, namaskar.
Sir, in acute ardit, we don't give medicines because it is Vata Dushti and Vatanuloman is required. So what we do is we give a spoonful of oil. The child is supposed to just put it down the throat. We neither give nasya or anything. We just ask the child to drink that. It's tough for the child because the mouth is on one side, but that helps. And we put cotton ball on that side of the face in the ears. So that helps prevent further development of ardit. It stops ardit and the child comes to normal very fast. We don't give any medicine in the acute phase, but we give tail, that is sesamum oil.
Thank you. Parulji, bahut dhanyawad ji, very clear. This is one of the challenges we have to harmonize our procedures. I think Naveen has raised a very interesting question. Acute condition, how do you manage? And perhaps we can all come together again to discuss this one point. Naveenji, thank you so much for raising this one point. We have several new people here. Devi Nayarji, Devi, namaskar. Aswathi, would you like to make some comments on these two questions raised by Naveenji? Would you like, perhaps you have something to add to this? Sophie-ji, namaskar. Perhaps you have something to add. Domaji, namaskar. And we have Suchita. Suchita, namaskar. The floor is open. We are fast approaching 9:30 in India. If we want to take questions from the floor, we still have time. If not, Naveenji, if you have any more comments or question. हमारे साथ आज है डॉक्टर, आई थिंक आई एम रीडिंग इट करेक्टली, डॉक्टर हार. नमस्कार जी. Sophie ji, I have one question. I hope you are here with us. Sophie ji, when we come into the Unani systems, I wonder if there is something you want to share with us about how this issue of cerebral palsy is appreciated in Unani systems. I don't know if you would like to add something. Sophie ji, namaskar. If Sophie ji is not here, I also request Dr. Har to comment on this, if you would like to. And there is somebody joining us on a Galaxy A31. If you would like to comment on something, the floor is open, ji. Suchita ji, namaskar. We've gone across the floor. Agnihotri ji, we have gone across the floor. There are no more comments coming to us. I want to thank Naveen ji for raising that one question, and we will discuss this with our colleagues. Rajagopala ji, we have received your phone number. Thank you so much for sharing your telephone number, ji. If there are no more comments, and as we are fast approaching 9, just almost 20 to 10 o'clock in India, I will draw this meeting to a close and share give the floor to Agnihotri ji. Agnihotri ji, pranam. Please. I don't know if Pavan ji is still here with us.
Thank you, sir. Thank you, sir.
No,
Namaskar.
Pranam ji, pranam ji.
Dr. Pavan Sharma ji is interested to say something.
Pavan ji,
or I should stop?
Maybe you can comment on some of the things we have heard today. And
Okay. No, Sophie ji is also here. Now Sophie has joined. I think if Dr. Sophie ji is comfortable, he can also add on something on today's webinar.
To hear if Sophie ji had some comments to give us the Unani perspective on this thing.
But I think he's also either in traveling or not settled.
We will wait, Agnihotri ji, just for a second. Otherwise, we will continue with our. Agnihotri ji, are you in Mumbai or Pune today?
Today I am in Mumbai.
Mumbai, chalo, subhas.
Just came from Pune on yesterday itself, and tomorrow we are again leaving Mumbai for Pune.
Oh,
because
you are traveling between.
Tomorrow night there is a US flight of my younger son for US. Yeah, from here itself. So this is traveling. We are just settling from this place to that place.
To another. We are endless travel. Too much water.
Yeah. Now almost whole family is completely here, and we visited today 45th story of our building.
Oh, wonderful. Wonderful.
I'll send you photos I have given to Pavan Sharma ji. So I think Sophie is not much comfortable to join us.
Doesn't want to add anything.
Yeah.
Agnihotri ji, before I share the floor, one last 30-second screen share जी. यहाँ पे शुरुआत में हमने जो किया जी, हम कह रहे थे कि हिंदुस्तान और यूके के बीच में जो बातचीत जो चल रहा है जी, उसके अनुसार हमें लगता है इसमें कुछ इंटरेक्शन हो सकती है इस टाइप की चीजों के ऊपर. और आज जो चर्चा हुआ सेरेब्रल पाल्सी के ऊपर, we can do a lot of things, क्योंकि लगता है हमारे देश में we have a good understanding of how this is to be managed and how it is being managed very in a difficult condition जी. And this is the National Institute for Health and Care Excellence यहाँ UK में, and they are the people who set the standards for treatment and the discussions. So एक तो वो चीज थी. दूसरा, इनकी अगर वेबसाइट में देखो जी, there is a details for different conditions and how treatments and recommendations are being made. And here is the document related to CP, cerebral palsy. And you will see to prepare a clinical guideline on the management of spasticity in children with a non-progressive brain injury. What we have learned from our speakers today is the importance of this. But what is missing here is they don't have the range of treatments that is available and being used safely in India. And they describe many things. What Rajagopala ji and what Aswathi has provided is a good description of what a common understanding here between the two sides. And what is also clear is there is surveillance of palsy in Europe, etc., etc. These are all things that Aswathi has presented today. And the data that is very important is the prevalence of palsy in the UK. It's about 2 per 1,000 live births. And this is, again, seems a common number between India and UK. And perhaps there is something here for a dialogue between the two nations. And I leave it there with the suggestion, as I made here with Parulji and Rajagopala ji and Aswathi ji and our colleagues in other locations in India and their interactions with Brazil. Perhaps there is an opportunity to develop a collaborative group. And we can also bring in other interested parties, Jaise aapne bataya Uttarakhand se. We can bring them all into this dialogue. Jamnagarwala can come in. And it becomes very easy to then at least start a dialogue. Maybe once every 2 or 3 months, we can come together, 1 or 2 hour meeting like we are doing now and share each other's things. And maybe out of these meetings, we can come up with a substantial program that people understand each other better. And Aswathi ji's recording we already have in the platform, so people can get an understanding of how Ayurveda thinks about this, so we can guide people. So with those few words, I want to thank all the speakers, and I pass the floor, and particularly want to thank Pavanji for holding us all together, and I pass the floor to Agnihotri ji. Pranam ji.
Pranam sir, thank you sir, thank you. I am definitely, I do agree with your presentation, means suggestion, and what is happening in UK. And as you told that the ratio is the same, the availability of the patients of this cerebral palsy. So in that way, that ratio will encourage us to proceed with the, apart from their management, with the Ayurvedic management. And I am quite happy and proud of the situation that Dr. Rajagopala ji and our Dr. Aswathi ji, these 2 persons are coming from such a place, one from Karnataka and the other one from Kerala. So in that way, she did her post-graduation from Udupi. So in that way, I feel that in no doubt, Karnataka, Kerala, these states are very rich as far as the Panchakarma, Abhyang process is concerned, and this is the leading processes for management of such cases of Bell's palsy or the cerebral palsy. Though sometimes
Agnihotri ji, Aswathi mentioned about Shankapushpi Churna. These are all things that are not available outside India. You know, these are very specialized.
Definitely. This is also a problem. And again, as Dr. Akhilesh ji told that he has done a lot of work with the Shankapushpi, with some other patients there. So the things are very open for all these, say, research workers and the great clinicians. But the thing is, proper Shankapushpi of its species should also be identified and made very clear that which of the species is making good results. One thing. The second thing, as Dr. Parul Joshi, Madam told, that is a very important issue, that if it is a case of Ardit or Bell's palsy, we need not to go for any otherwise oral therapy except the, giving a major quantity of oil, as it will suppress the increased Vata dosha. Very correct. And again, one thing which very much touched to our mind, and it made a point of proud, that Dr. Akhilesh ji told that the persons there in UK, they means question that how this Shirodhara is working, and for their quenching of thirst, he talked about the radioisotope included in that Shirodhara concept, and ultimately when it was found in the bloodstream, then they compelled to realize that it is happening, and this Shrodha is of great value. So with no problem, we were not having that much of research methodology and concept, though the text was there. As per our Prime Minister Modi ji, that you have got knowledge, you have got the process of that one, you are doing, you are getting the results, but you are not having the proofs. They need to prove. So that concept which he laid in Varanasi meeting. So that is the sector where we have to work, because Jamnagar center has been selected by WHO. So again, they are so crazy to know that what is written in text, to which extent it is confirmed or it is validated by any of the Ayurvedic researchers or any researchers of any pathy of world. So our today's webinar is so important that all the our learned guest speakers, right from our Akhilesh ji to our Aswathi ji and Rajagopala ji, they all made so much knowledgeful webinar today. We were really not getting that much expectations, but they did a lot. Especially our third speaker, she made Aswathi ji made such a coverage of the whole of this topic, right? Starting right from the definition, from modern side and all the details, then came to the management by the Ayurvedic text. So this is what we are interested to have such knowledge. Though the issue is this, that Naveen ji was talking something about the fuck rog and everything. We are supposed not to deviate from our main subject, because fuck rog itself has got a full-fledged say concept, its management and all that, and it is happening much more in India, and it is simply not because of the malnutrition, as described by Parulji. It has got different types, right from say Chiras and Vadij and etc. So we are not supposed to club all these such type of very important diseases in one thing. Today's our consultation was over the cerebral palsy, as we are having the world cerebral palsy day. So I extend my greetings and thankfulness to all my guest speakers, along with our so many dignitaries who joined today, and they were not less in number. Starting, we were 29 today, and by this time we are only having 12. So, but Sophie ji was here along with our CP Sharma sir there, Dr. Tomar sir was very much here, Professor Vishnu Sharma ji was there, Professor Madan Thangoli is always with us. So he is managing in the manner that the things can be made much more out in the field, especially involving with the Parul Joshi madam. And what I feel that in total, the persons who joined, especially Madan Sarji, Vipi Sharma ji, Rajan Patankar ji, Parul madam ji, Momita ji, Arun Pandey ji, our VC sir, who were very much here with in starting, and of course our Professor Prajapati ji, our Dr. Rakesh Prasad Nigam ji was also very much with us. So Neelam Chaudhary was there, Sophie ji was there, Rohit Singh was there, Professor CP Sharma sir was there, and what I feel that Renu Rathi ji was also there. What I feel is that the conclusion of today's discussion is so vital that may it be 4 in 1,000 or 3 in 1,000, the active approach along with the say hetus, Nidan, Samprapti, Sangathan, these are all so good things that even in the remote area also, with the help of the Ayurvedic such preparations, we have got wonderful options, Nasya, local application, massage, oil inhalation and everything, and along with the Shuddhara and Panchkarm, we can manage the patient up to some extent before referring to its higher center, or if the much more facility is not available, this much Ayurvedic profession may do miracles, and the modern medicine fellow sometimes really surprised at how it is managed and how we got the wonderful results. So with these few words, I pay my respect and thanks to all the dignitaries who joined to this webinar, along with our guest speakers who really gave a lot of inputs regarding one topic and celebrated the World Cerebral Palsy Day. Thank you so much. Over to Professor Madan Sarji. You're mute, sir.
Thank you, Agnihotri ji, बहुत-बहुत धन्यवाद जी. You have seen how from the few presentations, we didn't know what to expect, but what has come out in the 2 hours is the highest quality and most inspiring presentations. I want to thank Sharma, Akhilesh ji for showing us and telling us about the wonderful book, and Rajagopala ji for being so precise with his presentations and details of the treatments he is using, and Aswathi ji for taking us such a wide coverage on both the sides of the modern medicine side and Ayurveda side. I want to thank everybody for being here with us. I'll send a message here. Aswathi ji, please, if you can put your contact details in the chat box, then we can stay in touch. Otherwise, I can see Pavanji is there hiding somewhere. Pavanji, pranam. Pavanji, I don't know. कल के लिए शायद अगले प्रोग्राम पता नहीं आपके मन में कुछ हो तो.
Tomorrow is Universal Music Day.
अच्छा, Music Day, शाबाश.
Yes, sir. So we are celebrating music therapy tomorrow with Dr. K.K. Goyal and Vivek Joshi.
Chalo ji. You will be sending us a poster and the connection so that we can circulate it to people. कल सुबह मिलेंगे जी आपसे.
Yes, sir.
बहुत-बहुत धन्यवाद.
Thank you.
अब आपके हिंदुस्तान में तो 10 बजने में 10 मिनट है, तो आपकी इजाजत लेके पवन जी, can we close our meeting today with a big thank you to all our.
Sure.
बहुत-बहुत धन्यवाद. चलो पवन जी, I know you have to wake up सुबह-सुबह, आप भी उठते हो सुबह-सुबह.